priorities and frameworks. We want to make sure that we give this work the time that it needs. Um, so by the end of the meeting, our goal today is to have a draft of an agreed on framework for where in the harm reduction, prevention, treatment, and recovery continuum we're planning to allocate funds this biennium. And in our April meeting, we will finalize that draft into a decision that you'll vote on, and we'll turn our attention to how we'll be allocating those funds. So this is our agenda. Our plan today is to start with our roll call as usual and call for conflicts before heading into our board business. That will consist of a quick DOJ update, a fiscal update from Tammy, a quick update on the Learning Collaborative, and a RED subcommittee report. Then Adria will give us a high-level overview of the Oregon Opioid Settlement Spending Report that you all have had a chance to review and answer any questions you might have. And before our break, Zach and I will lead a discussion on the current SUD landscape from your perspective and what that might mean for your priorities. After our break, we'll go into our small groups where you will discuss how you would like to group allocations across the SUD continuum. And then we'll come back together and again workshop the an allocation framework that we can all agree on. As always, we'll leave time for public comment and then go over our next steps before adjourning. So let's get started with roll call.
Hi, good morning, everybody. This is Michelle Frizzell, Lisa's counterpart. April Rodham.
Here.
Adria Decker.
Here.
John McElveen.
Here.
Tammy Kane Suleiman. And we'll come back to her. And Annalise Stolf.
Present.
Zebulai Payne.
I'm here.
Nicholas Ocone.
Here.
Skylar Brucker Knapp.
Here.
Joanne Linville. She's out today. Julia Hyduk. Okay. Carrie Brajati.
I'm here.
Rick Trelevin. Rick Trelevin. Fernando Pena.
I'm here.
Sheriff Matt Phillips.
Here.
Representative Hai Pham. Senator Lou Frederick. And Celia House. Okay.
Hi, Commissioner Lori Trieger is here. I didn't hear my name. Apologies if I missed that.
I didn't call your name. I'm adding you to this list that I have. Thank you very much, Lori. Okay, that concludes roll call.
Thank you. And it looks like Bryce is here listening in for Rep Fam. Thanks for being here, Bryce. Okay, so this is our call for conflict slide. We will workshop a decision for a broad allocation framework today, but we will not be making a decision on any specific potential recipients. But this is always good for folks to read and keep in mind as we have this discussion. So I'll give you just a moment to read through this. And then on the next slide, we'll turn it over to Adria for an update on settlement happenings from DOJ's perspective.
Hi, everyone. Adria Decker. I'm an analyst at the Oregon Department of Justice. I do not have a big update for you today, except to tell you that the Purdue and Group of 8 settlements continue to progress, and we are working on getting those papered. So the next step will be filing judgments. Everything is going well. It's just a slow, complicated process. We have a couple more settlements in progress that I can't disclose yet, but we are working hard on them. So that's all I have today. The next thing coming up will be that the next reporting season will open July 1. So I will be communicating with subdivisions about getting the fiscal year 25-26 reports in.
All right. And I think, unless there are any questions, that brings us to Tammy and our fiscal update.
Good morning, everyone. Tammy Kelly. Just a reminder, I'm a fiscal analyst here in the Oregon Health Authority, the Public Health Division, and the Injury and Violence Prevention Program. We have some updates on spending, but a lot of what we're going to be working on fiscally for the board now is going to be the allocations for AY27. So we're going to have some information and resources for you there. Next slide. So the first table actually is the same as what we had last month. The last allocation that's represented on this table is from January 14th for the burn program for $13 million. We haven't seen any additional revenues come in. However, we are expecting by the end of the month in our scheduled payments to have some payments that are coming through. So when those do appear, we'll of course be updating our table and tracking the amount of revenue that's come in for this biennium. Next slide. And so here we have our allocation expenditures. Those continue to grow. I've added the column for the Behavioral Health Network. These are going to continue to be tracked. And as we move through and make additional decisions about allocations, the amount that has been allocated by the board will be updated as well. Right now, we stand at about 33%, and these numbers are representative of February, but February hasn't closed yet, so just a disclosure that they're not final actuals. And next slide. The final table I have for the board today is basically just an overview of what we're going to be discussing later about available revenue calculations and options for allocations for this biennium. It's really broken down into two buckets as requested by the board. We have available revenue that is expected from payments for this biennium, meaning that it's going to be received between July 1st, 2025 through June 30th, 2027. And the available amount is $23,405,000. And that number has been reduced already because there have been two allocations made by the board. Harm reduction in the amount of $5,149,231 back in that would effective July 1st, because that was actually decided in the previous biennium. And then the burn allocation that happened on January 14th for $13 million. So the funds available for allocation in the current biennium for payments expected is $5.256 million and a little more. But I also want to remind the board that we still have the emerging issues carry forward from the previous biennium of $5.311 million that can be considered as well. That is going to be discussed later on your choices and decision-making process. But with that in mind, if you look at both buckets, the total amount for allocation available, if you wanted to allocate all available funds, is $10.56 million. And that's just a summary I wanted to be able to provide so everyone has some resources and touch points. Are there any questions on the fiscal side that I can answer? Wonderful. Well, I look forward to keeping an eye out for the settlement payments that are going to come in for the group of 8 and for the Purdue Pharma settlements. As soon as we get those payment schedules, we'll update those as well, and we'll just keep staying on top of it. Thank you so much.
I will be in touch as soon as I know.
Thank you. Yes, I appreciate that.
Thanks, Tammy. Let's see, let's have Courtney go next and give us a highlight on the Learning Collaborative. And then I see that Dana's here. And so after you speak, Courtney, maybe Dana can give us a short update on the OTP work.
Sounds good. Thanks, Jenny. Hi, everybody. Good morning. Courtney Fultonier, she, her pronouns. I'm the Overdose Prevention Program Manager in the Oregon Health Authority's Public Health Division. Just a quick update on the local opioid settlement learning collaborative and a reminder that the learning collaborative is hosting their monthly meeting tomorrow. If you're interested in joining, you can email that link to receive the meeting invitation. On tomorrow's agenda, Adria Decker will be giving updates from the Department of Justice. Kristen Burke will be providing a presentation on Washington County's Center for Addictions Triage and Treatment. And then finally, there will be breakout discussions. These breakout discussions are going to be part of the Learning Collaborative regularly moving forward. This was in a response to feedback that we received from Learning Collaborative attendees that they want more opportunities to be able to talk and connect with each other and engage in that way. And so again, if you're interested, please feel free to join. These meetings are open to everyone. And with that, I will turn it over to Dana.
Good morning. Yeah, just a really quick update. Just wanted to give information on the DAOs. We had a report out from our awardee this morning, and they were singing the praises of the community in Dalles, that they were really excited about their open house. They had a great turnout. They had law enforcement there, other community partners. So things are moving along really well there. Their census is increasing. I think they reported it was around 30 or 40 individuals so far. And the only hiccup that they're encountering is recruitment of an additional counselor. So if anyone knows anyone that is interested in relocating to the Dalles, there's a position available and they would be super excited for applicants. So other than that, the other update I have is in Klamath Falls. We were struggling with the DEA schedule and getting them down there to take a peek at that new site, and we had received word that they will be there on Friday. So that's good news, and things are moving along with our other awardees in regards to drafting of contracts. So those are going through the process. So that's my really quick update for you all this month.
Thanks, Dana. All right, so Zach with our red update, our subcommittee update, and then we'll hear from Adria on our subdivision spending report.
Thanks, Jenny. Good morning, everyone. So just a quick red update today. We did not have a meeting in February. Sorry, a bit of a cold today. But at our March meeting, we are going to hear a proposal from Steve Westberg on data system spending and what that might look like, and then use that information to determine our next steps on evaluation. So that's the plan for March. Unless there's any questions, I'll turn it back to Jenny.
Yeah, and I'll hand it over to you, Adria.
Hi, it's me again. Just I wanted to say really quick that one requirement of our interstate settlement agreement is that there is to be an annual public meeting to share and discuss Oregon's annual expenditure report, including that of the subdivisions. And so we did that with the Learning Collaborative, and we're also doing it today. So incorporated by reference and publicly available on the OSPTR website is the annual expenditure report, and I refer you all to that to take a look at both the statewide and the details of the subdivision spending, which I am going to give you a very high level overview of kind of categorically that spending and how it compares to the board's allocations. So next slide, please. Next one. Next one. All right. So one, the first piece of information that subdivisions are required to report every year is how much they have received. And then secondly, how much they have actually dispersed or gotten out the door. So for fiscal year 24-25, subdivisions reported receiving $30.4 million across the 81 eligible subdivisions. nine of which have reallocated their shares to their respective counties. So they're mostly smaller cities that have reallocated their shares to their counties. So the counties have then reported those funds. This is somewhat lower than the 23-24 total, which was to be expected. And then as far as disbursement, cities and counties have dispersed $23.8 million in fiscal year 24-25. So it's continuing basically to double every year as more and more programs come online and subdivisions determine their priorities and get money out the door. Next slide, please. So these are the top 10 Exhibit E categories that cities and counties have reported using their funds for. The way we've designed the reporting system is that there's a drop-down menu. Cities and counties choose what the category that they feel most closely aligns with that spending line item, and it sort of varies how they report. But they're expected to report a payee and an amount and a category. So this is the top 10 categories. Uh, and it is definitely the case that certain types of spending could be reported under different categories. So, oh, next slide, please. It'll be easier to visualize in the next slide. Oh, Lori, please go ahead.
Thank you so much. To that, as far as it being across multiple categories, is there a notes field or somewhere? Where do we capture what more specific? Okay.
What more specific? Okay, so there's there's a line, like a line item where they write in what it was, who they paid it to. Some they're only required by the settlement agreement to report a payee. We've encouraged cities and counties to give us more detail just for the sake of completeness and for greater understanding of where the money is going. And then there is also a field, like a free text field that we call success stories and other information, where cities and counties can give us more detail about their current spending, their future plans, what's worked well, all of that sort of things. And we continue to encourage subdivisions to use that field as much as they can, just because it contributes to greater understanding of where we are.
Great, thank you. And that when you say and future spending, because this is disbursements, not allocations. For example, in Lane County, we are intentionally accumulating and sitting on funds in anticipation of construction of our behavioral health stabilization center, for example. So it looks like we haven't spent very much. We've spent a little bit here and there, but it's very intentional. So I'm glad we're also capturing something that shows that. Thank you.
Yeah, and that's exactly the reason why we've encouraged subdivisions to include kind of future plans, just because we have this 5-year time limit for spending funds upon from receipt. So if subdivisions haven't spent, or it's in the language in the settlement agreement is spent or encumbered. So like a contract would be an encumbrance, right? 5 years or 7 years if it's a capital expenditure. So we understand that there are other subdivisions that are doing just what you guys are doing in Lane County. And so we've encouraged the people who are doing the reporting to include those details, just so we don't get worried. Because the last thing that DOJ wants to do is to have to enforce the 5-year time limit. Fernando, I'm sorry that I'm not sharing. It's continues to be the same folks, the same computer sharing as before. So I don't know why it would be zoomed in now and not before. I apologize. I think we can go to the next slide though. So this is just a visualization of that same data. You can see by and large, or clearly the largest slice of funds is going to connections to care, support people in treatment and recovery, and warm handoff programs. So which with much smaller slices going to, um, again, this is the top 10, going to the rest. We can go to the next slide. So now I'm just going to compare the disbursements that subdivisions have made to the allocations that the OSPTR board has made. So for harm reduction and overdose prevention, OSPTR allocated 22%. However, so here, so that's on the right, and then on the on the left, and then on the right we have the subdivisions, the Exhibit E categories that they have reported. So we've tried to classify, we've tried to align Exhibit E categories with OSPTR board categories. So the Exhibit E categories that align with harm reduction here are naloxone and prevention of overdose deaths and other harms, or harm reduction. So subdivisions only spent 2.8% of their funds on naloxone and harm reduction in the fiscal year 24-25. Next slide, please. Primary prevention, the board allocated 22%, whereas subdivisions are spending 7.25%. Next slide. Treatment and recovery. So this is where we're making up the difference. Clearly, subdivisions are spending a large portion of their funds on treatment and recovery. And this is driven by a few things. Like, I would say probably the major driver of this is that there are multiple subdivisions that are spending a lot of money on building out new facilities. So obviously that's going to take up a lot of the funds that are out there. So the board combined treatment and recovery because the way the Exhibit E categories work, they don't really separate out treatment versus recovery. So combined treatment and recovery for the OSPTR board is 42%, but subdivisions are spending over 70% of their funds on the categories that align with treatment and recovery. Next slide, please. I'm happy to report that the administration spend is very low at 0.6% for subdivisions. Next slide. And then these are some of the other categories. It's kind of hard to compare, but overall, the portion of other categories is sort of similar between OSPTR and subdivisions. Next slide, please. I think that's it. So I'm happy to take any questions.
Yeah, we're a little bit ahead, so we have plenty of time for questions. Annalise?
So this is more of a comment, adding on to Lori's question and Adria's comments. We did at the last local subdivision collaborative throw out to the group around this question of planning, if they'd be willing to share that information. And again, the people who attend the collaborative, it's our very involved jurisdictions. But they seem to indicate, especially if we added it to this data collection, that they would be willing to share that. So hopefully we can start to get a little bit better picture of how local subdivisions are planning to spend it in the future to help kind of close down some of those questions about the 5-year gap. And then I will just share one of the things that Alcohol and Drug Policy Commission is doing. Some counties have local alcohol and drug planning committees or other designated committees that serve in that role. And we're doing a survey and some more outreach to the LADPCs in the coming months to better understand how they're doing their planning. So we might have a couple different avenues to start to work a little bit more closely with our local subdivisions. So just sharing that. And thank you, Adria. This is always so helpful for us to look through this.
My pleasure. And I really want to put out a plug for everyone to go look at the written annual report. It is rich in detail. This was a very, very high level overview. And many subdivisions provided a lot of detail in their free text fields that I found really informative, and I recommend everybody look at them.
Thank you. Any other questions? And Fernando, it looks like Zach also put the slides in the chat for you and anyone else who might want to see them. So those are available for you. And Fernando is asking for a link to the full written report. Adria, would you mind putting that in the chat?
Yes, certainly.
Thank you. Oh, Sarah Rose already did that.
Sarah is on top of it.
Thanks, Sarah Rose. All right. If we don't have any more questions for Adria or comments about the subdivision report, I think we can go ahead and transition to our current SUD landscape discussion. So we'll pull down the slides and just see everyone's lovely face for this. And so, I wanted, before we start the conversation about what your priorities are and how you might think about those priorities, we wanted to give you an opportunity to discuss among yourselves how you are experiencing the current SUD environment. This was a conversation, Nick, that you had asked for at our retreat, and we talked about it very briefly then. But I wanted to make sure you all had sort of a planned for opportunity to think about this together. So, just as sort of a round table, whoever would like to share, what are some words that you would use to describe, or how would you describe the current environment for people or organizations or local governments who are working in harm reduction, prevention, treatment, and recovery right now?
Could you put the question in the chat, please?
Sure.
Thank you.
So again, how would you describe, or what are some words that you would use to describe the current environment for people who are working in harm reduction, prevention, treatment, and recovery? And I know you all have thoughts on this. Fernando?
Yeah, I mean, I'll get us going. Terrified. Um, that's a word. Terrified. What's coming in 2027 with Medicaid contraction and loss of funding across the entire system? It's terrifying, is the word.
John offered fraught in the chat. Nick?
I would similar to Fernando, but like what I was thinking is just like tenuous or uncertain. Like we've built a lot out, we've developed really strong programs in our community, and we've lost funding from our CCOs. We've received reductions from the Measure 110 funding. Like um, there's a lot of uncertainty about our ability to continue to sustain what we've built and opportunities to build out to meet the need in the future.
Thanks, Nick. John?
Well, not surprisingly, I was going to add to what Nick and Fernando said, because they're excellent points. I just, what Nick said is really important too. You know, the Medicaid funding issues, but also as Nick mentioned, the CCO situation is extremely fluid right now. I'll say diplomatically, I'm not quite sure where some of this is going to land. It's obviously all connected. And I think it's the uncertainty that, again, both, Nick and Fernando mentioned that it's a I it's just it's not a great time. I'm just being very honest.
Hmm.
I can tell in talking with providers, and people can feel the tension and the stress, and it's not made up. It's a very real. It's visceral. I think I think it's actually a good conversation to have in context of investments, and thinking about kind of it in a holistic sense, in terms of our next sort of chapter in creating that structure of disbursement and allocation.
Yeah, thank you. Zeb?
Hi, thank you. Yeah, it's like the say uncertainty for sure. A lot of concern. As a program, you build for what the needs of the community are, and you move forward. But it's really hard to do that when at the same time, funding streams are threatened constantly or ever changing. So, you know, when you got a team of providers doing the best they can every day, it's a lot on the whole staff and program when there's so much uncertainty. So thank you.
Yeah, thank you, Zeb. Lori?
Thank you. Yeah, no one has said anything I disagree with yet.
Mhm.
I'm struck by, we say uncertainty as if we aren't always uncertain, but I think we're uncertain about different things, or the sort of magnitude or the breadth of that uncertainty is greater than ever before. As far as just single words, I would say anxious, frustrated, for sure, angry, um, sort of stretched. um, but I would also offer hopeful and determined, because we are seeing successes, right? We're in a moment based on what has happened prior to this moment. And based on that, there's a lot of um, determination and hope and commitment to the work, because we're seeing good results.
Mm-hmm.
A lot of these words are about this moment and what we're anticipating might come in the future. So I don't want to lose sight of that, because I do hear a lot. I didn't have the opportunity to meet with staff at the county who are doing the on the ground work, but from an ongoing perspective, what I do hear is a lot of still commitment and dedication to the work and excitement about the opportunities.
Mm-hmm.
But this moment and this fiscal and political climate creates the frustration and the anxiety that we are losing momentum or ground, or even going backwards in some of those things that have proven so successful. And I really just want to underline the CCO uncertainty, particularly with a Lane County lens. I don't know how many folks on this call are aware, but we've had two CCOs for a long time, one an out-of-state corporate for-profit, and one a locally based nonprofit, Pacific Source. And Pacific Source has pulled out of the Lane County market. They were unsuccessful in their negotiations with the Oregon Health Authority to remain in our community. And that was 90,000 lives that were covered here in Lane County, 90,000 lives. Trillium, owned by Centene, had a census of about 30,000. So they've had to absorb a triple client load, and it has not been an easy row to hoe. And so the sort of chaos and instability that's been created for individuals here in Lane County who rely on those services is not to be underestimated here in Lane County. It's been a
Yeah.
really big deal and a real frustration.
Lori, for those folks who might be on who aren't acronym savvy, can you say what a CCO is?
The Coordinated Care Organization. So it's the primary way that folks who are on the Oregon Health Plan and Medicaid access their health care. And here in Lane County, particularly with Pacific Source, we have worked for years and years to bring a lot of really innovative ways of connecting people to care, with using some of those funds for connection to community health workers and traditional health workers who are embedded within the trusted nonprofits on the ground. So people we have really built a strong network of numerous pathways to care for folks who would never make their first step be walking into a doctor's office.
Mm-hmm.
But instead they're going to get their food box, or they're going for energy assistance, or they're and so on, and they get that warm handoff and that support to enter into care. And for Lane County, this is especially Lane County government, not only is it important for our community and the people who live here that we're losing this locally based nonprofit CCO, but for Lane County government, we are also a direct care provider. We're the primary medical home for 30,000 people in Lane County with our federally qualified health centers. So we are also a contracted provider, and we were working with both CCOs, but now everyone's having to transition care and getting those contracts in place. For Trillium, the now sole CCO in Lane County has been very slow with providers, particularly with behavioral health providers. And a lot of people are losing access to care or having it slowed. And right, delayed care is lack of care. So
Yeah.
it's a really tough landscape. And I won't even go into the issues with our local hospital and what's happening with the Peace Health system, and how we lost an emergency department and downtown hospital, and what's happening at Peace Health with their ER services. It's a real crisis here in Lane County. If you want to know how is the healthcare system devolving, Lane County is your case study.
Thanks for sharing all that, Lori. I want to get to the sort of hopeful and determined that you were talking about before in a moment. But before we get there, just want to have a chance for people to share again, like you all shared some specific words like terrified, fraught, tenuous, uncertain, fluid, not a great time, tension, visceral, threatened, ever-changing, anxious, frustrated, stretched, and angry, as well as hopeful and determined. But just thinking about stretched, what does feel more strained than 2 years ago when we started meeting together, Fernando?
Yeah, I wasn't going to specifically respond to that, but I can, because I'd like to just overlay on top of all these words that we're using, that for culturally specific services, for services for gender minorities and sexual minorities, this is existential. This is not like there's no hopefulness in there. This is an administration, a federal administration that is actively seeking to harm uh, cultural diversity in communities that we're serving. So sorry if I can't be quite as hopeful as I usually am when answering this question, but that's because what we are looking at is what 40 to 45% of the Medicaid reduction is going to land on people of color and in rural areas, and that's services closing that barely exist already. So I think that we are just in the quiet before the storm that is 2027 when that reduction comes and services start closing. And as a result, unfortunately, most likely overdoses will start to go up again. So I really want to just ground us back into that right now, we're not at the worst of it yet. And for those communities, like we're already hemorrhaging services and staff for the underserved communities, and it's only going to get worse.
Yeah, thanks, Fernando. It's like we're seeing the storm approaching. So one of the places that you named in that answer as a place that feels more strained is it's more strained for rural communities, for minority communities, for gender diverse communities as well. Where else are people seeing the stretch or the strain?
Well, I'll say just staffing capacity. We've had to let folks go because we have resources have been reduced, and we're anticipating those reductions. And the interconnection can't be dismissed. As Fernando said, it may not be directly an SUD related program, but it absolutely is serving folks who need those programs. Our shelter beds, we are going backwards in Lane County. We received half the funding that we need. So we have shifted from a growing and expanding number of shelter beds with increasing case management and navigation services to a reduction in shelter beds with no case management. So we're back to warehousing people and fewer of them at that. And that is directly connected to to this work as well. So just reduced funds means reduced staffing, which means extra burden on the people who are staffing those programs. So the burnout and the strain and the sense of responsibility and trauma that the providers are experiencing is increased.
Yeah. Thanks, Lori. And Skylar, I saw you nodding a lot.
Yeah, sorry, I guess just
Yeah.
echoing, but I was going to say something similar to Fernando and Lori. I think the hopelessness is kind of the word that came to mind, and I didn't want to necessarily put that in this space, but that's just honestly what I think I'm hearing from a lot of folks, and the burnout especially. But I think to Fernando's point, from like a government perspective and kind of a systems perspective, I think the thing that really is scaring me is what Fernando mentioned, which is how many providers. Whether it's housing, we're hearing a lot from affordable housing providers, whether it's culturally specific providers, whether it's, it just seems to run the gamut. Health providers really are shutting down, are seeing the existential threat across all these different systems. And so I think to me, that's something I haven't seen since I've been in this work. And I think I'm pretty scared about that. Just really losing so many different providers in this space. And our system, it'll be really almost impossible to recover in the near term from that. So I think that's really terrifying.
Yeah. Thanks, Skylar. Zeb? Oh, where did Zeb go? We'll see if he can rejoin. John?
I was just going to add, Jenny, that obviously everybody is 100% spot on in various ways. I would say, though, that, and not to be overly optimistic, because as has been noted, there's a lot to be really, Fernando put it well, a lot of folks that we work with and people that, we know and that do great work in our state are facing that existential crisis. And it's not it's not a possibility. It's actively they're actively being worked against. And I think in the light of this board and the context of the board, that's why I think, and not to patronize or increase our importance as a body, I think it's really the leadership that this board has shown before, I think is needed pretty much now more than ever, to say, like, and to be responsive to folks and to think about how we structure things in a way that is really helping keep things together and not contribute to this kind of culture of chaos and destruction, basically, to be frank, that we're seeing. So on multiple levels, it's not just the federal administration, it's the payer issues that Lori discussed. These things are all kind of working together. They're all related, but I think that's why it makes our role even more important, quite frankly, right now.
Thanks, John. Zeb?
Hi, thank you. I know this has been said, but the staffing has been um, real issue. In order for us to keep our staff, we literally had to cut everything, like client support service. I mean, like supplies and harm reduction supplies and admin, like everything you can think of, in order to keep our people who are on the front lines doing what they do. We've had to make some real tough cuts, and so that stretches, to the clients as well. And there's things like contingency management that are really effective, but when you're drastic having to cut budgets, so you have to cut things like that are really effective. Another thing I've seen is workforce destabilization with larger companies coming into marginalized communities who have gained access to funds but aren't familiar with the community, so they're trying to hire from local community-based organizations. And oftentimes, so they try to peel people off from organizations that are, serving themselves. And that's a pretty scary thing to see when you got organizations that are dominant culture based that are taking providers from community based organizations, and that's happening. So, thank you.
Yeah. Thanks, Seb. Okay, so um, in the last 2 years, you all have worked hard at, as some of you said, working to build structures and to create opportunities. What feels more developed or expanded or stable now, versus 2 years ago? Fernando?
Yeah, I think the biggest thing that I can call out is more of a philosophical shift, that I think is a huge result, honestly, of Measure 110, which everyone likes to call a failure. But I think we didn't that program didn't fail. It just wasn't given the time to actually succeed. But what I mean by this is we also now have across the gamut, every layer of the system saying that we aren't going to arrest our way out of this problem, and that treatment and services is what's needed to heal communities and to heal lives. And that is now being accepted even from the most sort of like send people to jail. They're like, yeah, put them in jail, but get them to services. So I think there's an acceptance finally in the system that services are the answer. And then really the question is, how do we connect people most effectively to those services? And I think that's a very, very hopeful shift.
A philosophical shift that highlights connecting people to services. John?
I would agree 100% with Fernando. I do think it's been slow, but I would say it's a worldview shift, because I think there's an increasing realization from a very pragmatic standpoint from the public, from key partners in this work that we've always had in law enforcement and corrections, that these aren't just nice things to do if you have the funds to do them. They literally have a tangible outcome. And on that note, I also think it is hopeful, and not that, to discount all of the things that are happening right now and all the chaos, as many of us have mentioned. Our investments have done good. We our investments, the clearinghouse, we've invested as a board in the clearinghouse. Clearinghouse is a model, a national model. There are few entities, and I'm not saying that in a self-serving way because I was around from the start of it, but it is a national model. And to have that, and to have the board support without it having a regular legislatively allocated source of funding, or even directly from the agency, is pretty amazing. It's a testament to people that work, but it's also a testament to us as the board, you all as the board, stepping forward and doing that. As Dana mentioned in our OTP update, we talked with the folks that built the OTP in the Dallas that we invested in. They have the Dallas police officers, Wasco County, coming in and saying, we want to bring folks that we would normally have taken to jail into your treatment center. And I mean, it seems small, and people say, yeah, well, what does it matter on an individual level? There's all these things. No, those are kind of to what Fernando was talking about. Those are, I would call them even more like cultural shifts in terms of attitudes and the way that institutions see the work that we do and the work that we support as this board. So,
Love that. Lori?
Thank you. Well, John started down a path that's perfect for me to segue into, that cultural shift, that conversation shift. I mean, we still have so far to go around sort of stigma, but there is a greater and greater understanding of systems thinking across a system, not just a system of treatment or intervention. And to Fernando's point also, that that Measure 110 was not our county administrator likes to talk about failing forward. That Measure 110 was not a failure. It was a lesson in what happens when you try this or that, and then it was the timing and right. And so this notion of an interconnected system, of innovating to shift the system or move what part of the system we invest in, and specifically to what John was talking about, standing up deflection programs. And now that, at least again, I'm going to brag on Lane County all day, when you can show what you can deliver when you resource a program properly, we're having incredible results in our deflection program because we have one of the broadest sets of criteria for someone to be deflected so they don't even enter the criminal justice system, very different than diversion. And so when you show what you can do with that cross-sector collaboration, all whatever it is, 14 law enforcement agencies that have footprint in Lane County are involved and invested and using the program effectively, and we're getting real results with it. So I think we're really starting to see a shift from, as Fernando said, we're not going to arrest or jail our way out of this issue. That next layer of, so what are we going to do? And deflection is a huge part of that. And I will just put a plug in if people on this call are interested and don't know about the prison policy initiative, but they put together excellent information, and they just did a recent newsletter on specialty courts and whether they really have long-term efficacy in moving people out of a system and into healthier, independent lives. Spoiler, not so much as we like to think, which is part of making the case for deflection instead. So I'm happy to share that if we want to include the link in the packet. It's pretty compelling. But those were the innovations and the newest thinking at the time when we stood up, drug courts and veterans courts. And I wouldn't say they had no value, but we know more and we have more tools now. So the opportunity to really innovate in the space and think differently and remake a system is, I guess, how I would answer my long-winded way of answering that question.
Thank you. So you guys have talked a lot in this conversation about the interconnectedness of all the parts and how really SUD treatment, recovery, prevention is it's the sum is greater than the individual parts, but what parts of the system feel the most fragile right now to you?
I'll just say what Fernando said before about having a hostile federal administration makes the whole system feel pretty darn fragile.
Mm-hmm. Yeah, Fernando?
I got a lot of stuff popping up at the same time. Yeah, the things that seem most fragile to me, honestly, the Medicaid system. We're looking at estimates 100 to 200,000 people lost on the Medicaid rolls in a state that has one of the highest utilizers of Medicaid, especially for these types of services. Like that's huge. We're literally losing the ability for people to access the essential care, and not just for SUD anymore, right? This is complete. Just the collapse of Medicaid is going to have a huge knock-on effect into all the other parts of the system. Um, and so that to me seems almost like, uh, yeah, enough there. That's the most fragile part of the system right now.
Thank you.
I would really agree with that. I know internally at the county, we're looking at just what the Medicaid reductions have as far as impact on our crisis system and our safety net, what the impact is on our ability to continue treatment for everybody who's subsequently uninsured and might be engaged with no additional revenue that we're getting to support more community members that don't have Medicaid anymore. And so I think it's looking at the organizations that are being supported by Medicaid and supporting the community through Medicaid revenue, but then also just all of the other systems that are going to need to continue to support the community with no new funds in place when we have potentially 200,000 additional lives in Oregon that aren't able to receive primary or preventative care because they don't have insurance any longer.
Yeah. Yeah, so what does that mean for getting people or organizations the resources they need?
Well, I think the key thing, the reason that Medicaid I think is so looms so large in all this discussion in 2027, especially, that actual kicks in, is that our system relies on Medicaid for our grant dollars that we provide to be meaningful, right? A lot of times grant dollars are provided to supplement what Medicaid can't cover. But now we're blowing, that's just what Medicaid isn't covering just got bigger. But the grant dollars did not. So this is kind of like a knock-on effect for the system. It's like when this domino falls, there's dominoes that follow. And that is the ultimate question. Like, how do we square that? We don't have more grant money, and we're losing the program that supports essential function at many providers currently.
Thanks, Fernando. John?
An exact example of what Fernando's talking about and I've worked on federal grants for a long time. Our federal grants like SOAR, like the block grant. So for context, and obviously working with other states that didn't have Medicaid expansion, even our neighbors in the gem state next door in Idaho, they use that SOAR money and the block grant to pay for treatment. That's what gets folks literally to pay for the care, not we're going to use this to train. We're going to build new OBOT capacity in the traditional SUD system. We're going to support recovery. The majority of it goes to actual treatment. So I think that's what we look at, and we see that and go, holy cow, that reduces the ability for programs like our state opioid response grant to be innovative, to fund and support the organizations that already do those services. But like Fernando again said, some of that is not Medicaid reimbursable. But so it's a really nice, to say nice is kind of a weird understatement. It's a crucial part of building infrastructure, building systems that last. And I think we've done a pretty good job at that. But this environment puts that at risk. We'll do what we have to do, right? But it's going to be a lot trickier. There's going to be a lot more juggling of stuff, and some of it's just going to have to drop. I think I'm an optimist, not a pessimist, but just being realistic to the context of the conversation.
Thanks, John. Yeah, so we've had a lot of conversation in this discussion about what feels scary and hard and complicated. I'm wondering, coming back to hopeful and determined, what what opportunities do you see in this environment? What is there anything that's exciting and uplifting? What gives you hope? And I'm hoping to bring in maybe Sheriff Phillips, if you would like to share something. Maybe some of the folks who haven't shared so far. Tammy. Annalise and April. I'm not hearing a whole lot about the hopeful and excited.
I'll hop in, Jenny. Thank you
Thanks, April.
for pulling us in. I like to give a lot of space to the people who are closest to the work in these kinds of conversations. This is a role where I am not uh, close to the front lines as I have been in prior roles. So this is really where I do a lot of more listening. And I'll just say, in terms of the question that you're raising and hearing the silence speaking for itself, maybe a bit. I'll just say for me in this work, hope is sometimes a choice, and maintaining optimism is a choice that we bring every day when we decide to log in or show up and do the work. And I think the things that support that choice is knowing that we're committed to the work and serving our people and our communities. And seeing inspiration in the people who are going to continue doing this work. So folks from every meeting I've had this week talking about the struggles that people are feeling was represented in this conversation, and I feel inspired by their commitment to it. And I think what we do to solve problems together when we have uh, very finite resources and infinite demand is the tension that we wade through all the time, and the externalities seem to be turned up a bit. It's been a while since we've been in reduction scenarios. It's been a while since we've had such I'll say, as Commissioner Trieger alluded to, hostile federal environment for many of our communities, for most of our communities. So I think that this is a moment where relying on inspiration and decisions to remain optimistic is important, and seeing the momentum and holding on to it where we can.
So yeah, you're inspired by the commitment and the hopeful determination that Lori described earlier. Fernando?
Yeah, I don't know that I want to use the word hopeful so much, but things that I think are inspiring or that we need to key in on. We have, like I said, alignment. There is alignment across all the sectors that this is something that we are all in together. The state of Oregon, the citizens, we are all in this together, and we know that this is something that needs to be addressed together. Things that I think are also inspiring: the ADPC strategic plan is designed to start building systems from the ground up where needed, and to continue to invest strategically and long term in that growth so we can withstand these things again. Um, and then I think the last thing I'd want to say is, instead of hope, what I feel right now is courage. This is a time for boldness of action. Um, there's one of those. The way I think about it is just like, if we're going to lose anyway, we might as well fight. Um, right? We're gonna fight as hard as we can because that's what the citizens of the state need us to do. And again, there's alignment in doing that. We've also got this amazing workforce that we have spent a lot of money in investing in. Granted, they aren't going to have too many places or as many opportunities to go apply their trade for money, but we have loaded up the continuum, especially at the bottom services level, with a lot of people over the past couple of years who are at least aware of the disease of addiction and how to support people in that. And that makes a huge difference as well. And so finding ways to be bold in this moment is, I think, almost more important than, I guess, hopefulness goes with that. I'll stop there. I process verbal.
Yeah, that was great. A time for courage. Skylar?
Yeah, I think it's very similar to April, but I do think one of the few things that I'm seeing that gives me hope is, budget cuts necessarily require some innovation and force people to the table in a different way than they've previously maybe not have engaged with each other. And so I think I am seeing, kind of to Fernando's point, every alignment in a way we haven't seen. And that's something I think to be hopeful for. I think in previous years, we've really had this kind of glut of funding from different sources, which is amazing, but it really doesn't force people to the table in the same way. And it doesn't force you to really think as critically in some situations. So I think that's my one kernel of hopeful kind of innovation that I am seeing.
Yeah, necessity is the mother of invention. It's necessary. We're
Precisely.
inventing. Zeb?
Yeah, I think people made a lot of great points, and I think it was Commissioner Lori that said, uncertainty's always been a thing, and it is true. So I think one of the great things about Measure 110, it's been uncertain since the beginning, right? Always been political, um, hot topic, and funds have been threatened from the get go. So it's not like we ever really got comfortable with that. But what I'm hopeful for is the people I see in these meetings working towards solutions. And like Fernando said too, the workforce that has been built in these last 4 years has been really amazing, and that's awesome. And I know we're going to figure this out. We'll have to get innovative, like Skyler said.
So before we head to break, just one more question. How, and this is, I think all of this is really relevant to the conversations you're going to have in your small groups, um, but how do you expect conditions to change between now and June 2027 when the biennium ends? And I think, Fernando, you alluded to that when you said, that we're not in the worst of it yet. So how will conditions change between now and June 2027? Does it feel like the it's going to get worse? It covers it?
I think what'll be different between now and June of 2027 is that some of the unknowns now are going to become knowns. I think we'll have a better handle on how many folks will lose their Medicaid. We'll have another year of CCO revenues that aren't keeping up with demand. And so we'll know at that point if there has been another round of cuts. We'll be in the middle of a long session. And so we'll know what the biennial budget is looking like to support services in our community. And so I don't think that there's going to be any sort of alleviation of the strain that we are talking about today. But I think right now we're bracing ourselves for all of these things and these realities. And I think we're going to have a little bit of experience under our belts at that point, and we'll know what we're working with. And honestly, we'll have the resilience of the community and the system tested a little bit more by that point.
Yeah, I guess to Nick's point, what will change? I think I want to view that question rhetorically. Like, what will change? That's the question. Not what we're expecting to change, but what will we change in our approach? Is a much more salient question at this point. We don't the silence that you like April said earlier, like the silence speaks for itself. What will change? We don't know. That's the literal question. We don't know. So this is the moment where the boldness of action comes in. Like, what will we change to try to ensure the long-term sustainability of these services?
Oh, I think I have to stop the conversation right there because that feels like such a great note to end on. Thanks, Fernando. And okay, so we're gonna have a break now. So we'll come back in 10 minutes. Why don't we just go ahead and we can take a very slightly longer break and just come back at 11:25 as we planned. And as you're on your break, think a little bit about what Fernando said. What will we change? Because when we do come back, we're going to give you your instructions for your small groups, and then we'll get into small groups. And in your small groups, you are going to be talking about how you want to allocate the funds across the buckets of funding in this biennium that we're in. All right, so we'll see you all back at 11:25. Okay, so time to come back if you're not already here. Welcome, everyone. So that was such a good conversation. Nick, I really appreciate you highlighting the need for us to have that conversation and all of you for just really being honest and showing your determination and your courage. As well. Really appreciate that. I think it's going to be really important as we take that into um, our small groups. But before we do that, I wanted to bring up a slide that Tammy shared during her fiscal update. So this is just a reminder that while we expect to receive just over $36 million in settlement funds during this biennium, we've already allocated 30% of that, or about 10.8 million, to Oregon's federally recognized tribes. We've allocated about 5% of that, or 1.8 million, by statute towards administrative costs. Back in July, you allocated 5.1 million to Save Lives Oregon, which is that goes in the harm reduction funding bucket. And in January, you allocated an additional 13 million to partially cover an anticipated gap in burn funding. So that leaves just over 5.2 million available for allocation from the fiscal year 27 expected revenue. And as Tammy shared, you also have an additional just over 5.3 million from the 2025-2027 emerging issues bucket that you voted to carry over into this biennium. So that's what you'll be working with in your small groups. Okay, so yeah, Zach is going to talk to us about logistics. Then we'll head into our small groups. Zach will probably mention this, but members of the public will be able to register to join one of the small groups. You can't be in all of the small groups, but you can join one of them. And but you will be joining as an observer only. This is a webinar, so you won't be able to share in there. We will have our public comment period after we sort of at the end of this meeting. Another thing is we will be recording the small groups. So just a reminder to all of the facilitators to hit the record button when they join. So I'll hand it off to you, Zach, to take us through our logistics.
Thanks, Jenny. So here are our groups. We're going to have 3 groups based on attendance today. Each of these groups is going to have someone from PRR serving as a facilitator and note taker. These are mainly just going to be conversations amongst yourselves, but the person will be there to provide updates on time, answer any questions you have, and then help summarize your work for the report out at the end of the discussion session. There are a few discussion questions that your facilitator will share with you when you get into your groups, and those will guide you through what you want to do with that emerging issues bucket that we talked about, and then how you want to allocate the remaining funds across the different categories. In the meetings, they're going to be Teams webinars. So in a minute, you're going to get an email from Teams with a join link. Sorry for the inconvenience there. That's just the way we had to do it with the public meeting requirements. So you'll get a separate email from Teams with that link. If you don't get it, let me know. We'll give you a few minutes up top to get into those rooms in case there's any issues. But those just went out now. And then you'll be in those small groups until a certain time.
Yeah, I think 12:10. Did we?
12:10. Yeah, it's 12:10.
Yeah.
If you get done early, that's fine. Just head back to the main Zoom room, and then we'll continue on from there. Anything else, Jenny?
I'm just going to put the questions that you can use to organize yourselves in the chat for everyone. And then the facilitators also have those questions, so they'll share them in the chat. Tammy was kind enough to make a spreadsheet tool so we can play with things in real time. So you are welcome to use that or not, as makes sense to you. And as Zach said, if all of the groups come back into the main room before 12:10, we'll just start the conversation at that point. So don't feel like you have to just hang out if you were quick in your decision making. If you are in the main room before everyone else comes back in, you're welcome to, do some other work while you wait for everybody else to join.
And then if you are not a board member and would like to observe one of the rooms, I just dropped the registration links in the chat. So just pick which group you would like to join. It'll just ask for your name and email, and then you'll get a link to join one of the rooms as well.
And again, you'll join those as, if you're not one of the board members, you'll join those as an observer.
Yeah.
All right.
So I have not received an email yet. Should I use one of those links or just wait to see if it shows up?
Let me take a peek.
Are there if other board members have not received an email, can you raise your hand?
Mine went to spam, by the way, everyone.
Oh.
Okay. So it looks like Nick also has not received it.
Mine came as a calendar invite, if that's helpful with a link to join.
Okay. Good to know.
Looks like April also is missing one. And these are Teams. Yeah, these are from Teams.
Calendar invites go to my scheduler, so I don't
Oh,
know
okay.
if I'll get it.
I think in that case, April, if you just register via the link in the chat for room 1 in your case, you should get an email.
Thank you, Zach. I'll do
Yeah.
that.
Yeah, and if anyone else has still not received it at this point, I would go ahead and just register to your assigned room in the chat.
But does that not just make you an observer?
We will upgrade you.
Gotcha.
Yeah, I suspect that mine has gone to our filter and I'll get a summary later.
Fun.
Okay. So I think, April, you have your hand up. Is that?
Sorry, that was just a leftover. But I did sign up for public comment and I don't need to.
Got it.
All right, so you will need to leave this meeting to join that meeting. So yeah, yep, exactly, John. We're leaving the Zoom meeting and we're joining the Teams. All right, we'll see you all over there. I'm making my way to room 1. Hi, everybody. We got Fernando, we got Carrie, and I think I will need to check and see if we have anyone join that needs to be upgraded. Hey, Lori, can you check your microphone and make sure it works?
Yep.
Okay, good. You're in. All right, so let's see if we're waiting for anyone else.
April, I think.
Okay. And I don't see April. Oh, there you are. Okay, I think we have everybody, and Mitch is joining as an observer. Hey, Mitch. Okay, so yeah, our job today, should we choose to accept it, is to think about how we are going to allocate the really kind of a little bit of funding that we have left unallocated um, in order to yeah, to fulfill your role as the settlement board. I'm gonna just a second share my screen. Okay, you all should be able to see this. I'm gonna make it a little bit bigger. We have two tables. We have our first table is a scenario in which you decide to leave all of the emerging issues or some of the emerging issues in funding that $5 million where it is. And so in which case that gives us about $5.2 million to play with. And the second scenario is if you decide to take, again, that emerging issues funding and reallocate it, some or all of it, the into the other funding buckets. So the first question I think I have for the group is, do you want to keep some or all of the emerging issues funding from 2025 in that emerging issues bucket? Or do you want to reallocate it into the other buckets?
Okay,
Oh,
I'm already.
Fernando, there we
I
go.
was
Yeah,
I was looking at the bottom, and now we're up at the top for the
sorry.
microphone button. Yes,
I know.
different
This,
platform.
yes, it's annoying, but
Yes,
thank goodness we have these capabilities.
to my mind, especially as the numbers begin to get smaller of what's able to be allocated, that it's probably best to think of it as all just one pot of money. That's to my mind.
Yeah, what do other folks think?
I think for me, it kind of depends, if I'm being honest. Because of all the uncertainties in the environment, there's part of me that thinks it would be nice to have a little bit of funding available for emerging issues that might come up. But because our funding, the dollar amount's so small,
Mm-hmm.
it feels like it's going to be really hard to have a concrete, tangible impact with the without including that emerging issues funding in the bucket. So for me, I keep thinking like, what is something we can do that has a really tangible, concrete impact with this amount of funding? And I think if we felt like we had something where that all of putting it all in would really make um, a difference, then I think I'd be behind that, if that makes sense.
Yeah. April, I know you like to sit back and let the folks who are on the ground talk, but I think you're all, with the exception, Fernando's our frontline person here. So yeah, what are you thinking?
Now I'm all messed up, and Teams
There
is
you
my
go.
home platform. So
I know, but you
I
get
was
used to
gonna
one
say,
thing.
I was gonna say Lori came off mute, so I want to give the mic
Yeah.
space if you were ready to go.
I'm fine if you are, but I'm happy to.
Yeah, Lori, why don't you share and then April?
Sure. I think I'm thinking of it a little differently, and rather than focusing on the amount, I'm wondering if we can sort of reverse engineer our way into it first by making sure there isn't something we've already made an investment in that now with the new federal landscape has a gap it didn't have when we made that initial allocation, to
Mm-hmm.
make sure that we're not missing an opportunity to help those across the finish line. So I don't know if there's a way to assess that, but that would be, um, I would hate to allocate this. It is a relatively small amount and then find out something we have already allocated to that was waiting to finish finishing all its puzzle pieces and putting them together came up short, and we could have um, helped with that. So I don't know if that's something that's easy to assess, but that would be something I would want to check on before we put money into new initiatives somewhere else.
Yeah, let's think about that in a moment. But April?
Well, I fully agree with Commissioner Trigger's assessment and concern about not necessarily knowing the gaps. I mean, I think, the conversation you started us off with kind of shared a lot of where we all are in alignment on, which is a lot of concern about unknowns at this moment, and sort of where those impacts may hit. So I think if I coming into this and preparing for it as I did, my recommendation would be to move towards a single annual grant making process, RFP, where we would invite people to apply and we could design the request to include, are you experiencing or anticipating a fiscal impact from other funding sources to your programming for which you are now needing, like, is this an existing opioid settlement funded program? Like, is there additional funding needed now that you've lost from other sources? That kind of thing. But I think if we designed an RFP that included that was broad on the front end, inviting applications for all the eligible activities under the statute, and then used an evaluation criteria that prioritized or heavily more weighted things for investments in areas with higher overdose rates, investments for populations with the highest overdose rates. I mean, you sent along in the meeting packet some really useful information that I took pages of notes on. I did my homework, y'all. And talked to some of our colleagues about it. But just to confirm some of what I was thinking about it, but just, if we were able to prioritize funding for improving access to sort of, along the lines of the conversation around like what we do that's working, but thinking about the system of care and thinking about improving access to immediate access for people to detox inpatient, or for people experiencing homelessness and or coming out or into reentry programs, right? So there's like populations based on data that we know that are at highest risk. And if those are things that can complement the system and we can heavily higher weight those proposals, we have to do it in a moment of time because we'll be spending forever thinking about where the next best dollar investment is. And we have to pivot to the rest of the work that I think is also meaningful for this board to engage in. But I do think that if we spend some time upfront designing a solicitation and then the evaluation criteria, we could get at the opportunity, the spirit of what the emerging issues category was, by being able to point people towards this application process. And then as if we get additional funds during this year or the biennium, we could reopen or maybe keep open the RFP and just sort of see rolling applications for us to evaluate. So I'm getting way into the weeds here, but that's kind of what I'm
You are.
thinking.
You're anticipating our April conversation, actually April, which is appropriate. And because our April conversation is about how we get the dollars out the door. But I think what I hear you saying is maybe we don't need to differentiate the buckets so much. We just know that we have $10 million, $10.5 million to allocate.
I'm realizing I wore a sweater that matches the raised hand, so I'm like, there I raised my hand.
I would also put up just one more like on my proposal for all the things, but I also think that we should look at what that $4 million we have in data and evaluation. And so while we have 10.5 right now to roll out for programs, I think we need to have a board conversation and really land the plane on a scope for that work. Which feels a little bit ambiguous, to be honest, from my perspective at this time. So I know that that's not on this sheet, but it is in my mind of resources and work for the board to do in addition to this sort of initial allocation process.
Yeah, and that's definitely on the table for the Red Subcommittee to discuss starting next month, or I guess this month as well.
Yeah, we're for real quick, just a quick on the Red Subcommittee stuff. Literally, I agree with you, Roman, April, sorry, and we are definitely waiting with bated breath to hear from OHA what they are finally proposing after about 3.5 years of just waiting to get this work moving. I think it's time to start meaningfully looking at what we're going to do with those funds in other ways.
Yeah, and it sounds like they do have a proposal to present at the next Red Subcommittee meeting. Lori?
Great. Yeah, thanks. I agree with that. And I just want to add, if we go the route of sort of an RFP, we keep it simple. So I'm very proud of our low admin, and I don't want to drive that up by creating a complicated grant making process. In addition to folks who may have lost or not received anticipated funding, is folks who are facing an extreme increase in the cost of a project, because that's definitely happening, particularly if it's a capital project. And I'm wondering, I have two thoughts, and I'm really looking to Fernando as sort of our frontline person in this group. Thank you for doing your homework, April. I usually like to and just wasn't able to this time around, but the little bit of conversation I did have leads me to ask, if we were to pick a bucket, whether it isn't right to prioritize the treatment bucket, because as we've seen overdose rates drop, that is actually the ripest time to make sure people have access to the treatment, because that's what makes that number kind of stick in a way. That's when people are at their readiest. Perhaps, so that's a question for Fernando, if that's something that he agrees with or wants to share more about. And then my one other thought, also going to what we talked about in the large group and that Fernando in particular brought up, is rather than buckets of approaches, is that we prioritize structurally marginalized communities who already have a disparate impact, but also are even less able to access certain kinds of funds because of the hostility of the current federal administration. Even if they're accessing those funds, like through, for instance, at us at Lake County, we've had to adapt and modify and do some very creative and acrobatics and workarounds to continue to work with certain populations because of federal constraints on language we can use. So recognizing, I mean, an emerging issue is a hostile federal administration. That's an emerging issue. So,
yeah.
Yes. So the whole thing is an emerging issue, really.
Well,
It's all emerging.
It's because Lori specifically called me out, my name in this. I think that in these moments, sorry if I sound like a broken record. in these moments, I like to question unspoken assumptions. And one of the unspoken assumptions is that we have to maintain the bucket allocations that we started with to begin with, right? At the beginning of this whole process, we were just moving quickly to get money out the door. And somewhere along the line, those allocation buckets have become like, well, this is the framework and this is how it has to be. Even if we're not saying it, that's kind of the thing that's in people's minds. So what April is proposing, I think one of the things, the knock-on effects of doing that buckets allocation thing is that we didn't actually create any process for money to get out the door for projects. And so we have this kind of just like people can kind of ask and we don't know. So using this pool of money that's still there to remake the allocation process for moving forward, I think is the best thing to do. And then the next question becomes is how do we as a board pick priorities for scoring those RFPs to determine where the money goes. And so, like Lori just said, there's going to be the marginalized communities that are going to get hit hardest. So do those get weighted higher? If it's overdose prevention dollars, do those get weighted higher or lower? If it's money that went to, like, for example, OHSU got some money. They're a large organization. Yes, everyone's running a shortfall, but OHSU could probably withstand it more than like a small RCO in Lane County, which only has like two of them anyway. And so I think this is where we can start moving the sort of the path that we're on. So it's not like we're going to give $10 million. Okay, what, we're going to give 2 million to treatment? That's significant for a small program, but overall it doesn't really make that huge of a dent. So moving it towards a more project-based grant with the board then functioning as the scoring, developing the scoring system. It also puts us back into the normal OHA contracting process. One of the things that we learned through this was that OHA thought they could move money quicker. If we thought that we could get the money moved quicker through a direct allocation, turns out because that's so far outside of the normal process, it actually slowed everything down in a way. A lot of words there. Love to hear what everyone has to say.
Yeah, I love this thing that you said about are we assuming that those buckets that may have worked well for the group in the 2023, 2025 biennium, are they still serving this work now? And I think that's a good question to put to all of you. Does it make sense to separate out the funding into these harm reduction? We already gave $5 million to harm reduction. Yeah, $5.1 million to harm reduction. But does it make sense to keep the primary prevention, treatment, recovery, research and evaluation, and emerging issues buckets that we came up with a little over 2 years ago? Or do we want to move to something that's a little bit more responsive? Because then we're going to present this to the group when we all come back. So,
Well, I'm wondering, Carrie and Lori, how are you all feeling about the kind of what April proposed, and we're kind of like thinking about building out a little bit.
I struggle with RFP processes because I think that we always struggle to apply. And we're a pretty well-resourced nonprofit. So I worry about smaller organizations having the capacity even to do a simple RFP. And I think also when the funds are time limited and there have to be project specific, we can't hire new staff. So we're struggling to find projects to do that maybe aren't aligned with our operations. So I think, I guess looking at maybe some just like operating support funding might be something that I think would be really useful in the environment we're in.
we do have, there's a 5%, I mean, OHA has 5% of the funds that we haven't used, OHA hasn't used 5% of the funds, but you know, there is that potential funding for operating support. And the other thing I just want to say really quickly is the only decision that we're really making today is what that framework is. And we're going to talk about the how and the mechanisms in our April meeting. Um, so yeah, I don't want us to get hung up on the details of how we're getting the money out the door just yet. Although April, you did propose an RFP process. That is one mechanism that we could look at. I want to keep us a little bit more focused on, you know, are the buckets serving us? And if so, how do we want to prioritize funding within those buckets? And if not, then what does it look like? Uh, to not have buckets.
Well, I would
So,
argue that.
go ahead.
Go ahead.
No, it's
Yeah,
fine. Go ahead.
yeah. I was going to argue that those buckets have never really served us. They were a tool that we used to make rapid decisions. Those were not very intentional, and that's what we're trying to move towards, is a more intentional process. And to maybe Carrie's concern is I was the executive director of a small nonprofit that had to write grants against organizations that had grant teams that were larger than my organization. Uh, and to allay those fears, as someone who's had to live them, is that we will be setting up I guess if we move towards this away from the buckets process and more to an RFP process, we'll be designing the RFP. And that's actually, then we move more towards like a grading of how those grants get graded. And you can literally say like, well, what's your annual budget? Hey, large organization with a $90 million annual budget. Sorry, but your request is not going to be as important as this organization that's got a $1.3 million annual budget that can get more money, more value for their dollar, for that dollar. But I don't think that again, those buckets were, we took the names, we took the words out of the name, the opioid settlement, treatment, prevent. We just took the names and then roughly divided it up equally. And then with the emerging dollar buckets, we just started taking little percentages from each to create that. But it was never an intentional process. And so I think moving more towards the intentional process is better. And with the dollar amounts, the RFP process actually can maximize the usefulness of it, I think.
Potentially. Yeah,
Yeah.
Carrie, what were you? Let's finish your thought.
I have a lot of thoughts, and I'm trying really hard to measure what I say, because I feel like for me, the buckets create an opportunity for prevention to stay in the game, because we are literally daily responding to emergencies, and we do not want to let people die. I don't want to let people die, right? So I feel like when you were talking about courage, Fernando, like to me, like, I feel like when I looked at the materials for this meeting, when I looked at the jurisdictional investments, they're going into treatment. They're, so our resources are already going into those buckets. And to me, the value of the buckets is that there is still a space for prevention, which is not responding to the emergency, but changing the long-term outcomes for our world, right? And so to me, like I have accepted that we are going to lose prevention in the environment we're in. I think I have to, but I feel like I can't stop standing here and shouting that, like, if we want to create long-term change, we can't neglect having upstream prevention that is working to change the environment in our communities so people are not needing treatment, not needing harm reduction. And so that to me is why the buckets are valuable and important. So that is my 2 cents about that. And I probably had other things to say, but I think that's kind of where I stand, and I'm just going to probably always stand there and be willing to support allocating additional resources to treatment and harm reduction in an environment where that's what is required of us.
Yeah, I mean, I'm just remembering, Carrie, the excellent presentation that was given by the in-school prevention program in the fall, and just how inspiring everybody found that. Yeah. So April and then Lori.
Well, a few things. I guess, Jenny, I hear you. You want us to focus on the like, what do we think about the buckets and not get too far ahead of ourselves. And I understand that there's like a timeline that we have. I think there's also maybe an opportunity for us to move as quickly as we feel comfortable. And if we can get there, then why not take the opportunity to get money out the door? But I also, I think thoughtfully, right? And making sure that everyone feels brought along. So I'm hearing, I guess my questions for mostly for, I mean, I think in terms of hearing Carrie's concern about prevention, I feel like there's a pathway to say, maybe if we did an application process, or we could put in on the other side, we want to aim for this much investment in each area, but leaving the door open for, because what we may find from the applications is that if we prioritize populations most impacted by federal cuts or other funding cuts, then they may want to, what they want to do with that, I think is important to hear. And being broad about it allows people to tell us what they want to do with it instead of making people apply to 5 or 6 different applications. But I guess in terms of if we are, I want to understand a little bit more about like the impact of having to respond to an RFP versus having internal decisions made about funding allocations, because I feel like then we're making assumptions, I guess, as Fernando said, about what it is that we can fund, because it will be based on either OHA contracts or creating some sort of survey of regions. It's not out of the possibility for us to say we want to survey it's like Clatsop County, Multnomah County, Lane, and Josephine are like the top counties in terms of overdose rates. Like to be able to say what are their biggest gaps in your region that you'd like, that creates a different conversation and who's invited to have that conversation as opposed to sort of an open process. So I don't know how we balance the like internal government to government conversations versus like just saying, hey, we want to prioritize these populations and we have this money available, tell us what you can do with it, kind of thing. But I'm not sitting on the side of the organizations who apply. So
Yeah. Yeah. And April, part of the reason I want us to stay a little bit outside of the mechanism conversation, even though I see that you do really want to get there, is so that we have time to have this conversation that Carrie is talking about, that gets us to that priority conversation. So, priorities first, then mechanism. And I think that having that being thoughtful about it up front is going to allow us to be faster on the back end. Lori?
Thank you. Well, first, I want to just really appreciate and echo Carrie's statement about prevention and add the word primary prevention, because that is also a unique part of prevention. The pre-prevention is the primary prevention, because it does speak to not only because it is invisible and stops a problem before it happens, the hardest to make the case for investing in, but we know it is also the most long-term, what sticks the best, and it is systemic and structural versus programmatic or of a moment. And that kind of goes back to the rigor and the discipline we all committed to having since we seeded this board and throughout the process, that this is such a unique opportunity that we have to be very protective and not get pulled, not get pulled by a moment of to raid the pot, right? Which has sort of happened a few times already. It's okay. We agreed to do those things. Outside entities making requests of us, but I think that's just something to stay stay with some discipline too. I'm going to go one better than I don't think we need the buckets. It's not worth quibbling whether I think there was any process or rhyme or reason to creating them in the first place, but I do think they served us, and thank you very much, buckets, for your service. And I'm also, though, going to push back a little bit, Jenny. Maybe it's just a semantics different, but I don't see, or I see an opportunity to talk about the framework and the mechanism together.
Mm-hmm.
The process is an outcome. The process by which we offer people to access these funds that you're calling a mechanism can be the framework. I mean, I'm just pushing
Mm-hmm.
back a little that we separate those things out. And for example, like what I put in the chat and that we've been talking about, understanding the impact of these funds on the stability of an organization. You're talking about that as if that's a how, but I think that's part of the framework.
Mm-hmm.
So I also, not only do I want to thank the buckets for their service, but I want us to think about the mechanisms as the framework, or the framework as the mechanisms.
Mm-hmm.
And again, because it is a relatively small amount, beginning with the end in mind, whether that's serving specific populations, serving specific geographic regions rather than specific approaches, is
Yeah.
feeling better to me.
I will say, when we were originally going to have this conversation in January, the idea was to put you guys together in these small groups for a much longer period of time and have you come up with a fully fleshed framework mechanism, and then to present that out to the groups. And because we're parsing these out into different conversations, because we're not all together all day, we're not. That's the reason for sort of helping to separate it out, because it's possible we just don't have time to get all the way through the conversation thoughtfully. But yeah, you April and Lori are right that it can be helpful to have the two conversations together when you have time to do that. Fernando?
Yeah, I guess to Lori's point and to April's point, I think that focusing on the buckets mechanism focuses on a tactic and not on a strategy.
Mm-hmm.
Once we make a determination that I'm just speaking extemporaneously. So let's say we make the determination, we're going to put all the money together, including the money from the research evaluation dollars. That's how much we have in there. Strategic, like the strategy we're trying to accomplish is to ensure the sustainability of existing programs that were funded, that needed, or culturally specific. We can do all the weighting of things and all that stuff. But ultimately, if we just focus in on the buckets versus the RFP process, outside of the larger thing, the larger strategic question, we're just going to end up duplicating work.
Mm-hmm.
The other thing that I'd like to remind everyone is that we are sitting on roughly $15 million right now-ish that could be desperately used, or that's desperately needed into the system. And so the longer we push conversations out, the longer that money sits there without being used in the system, regardless of where it goes. So ideally, I'd like to get us to a spot where we have a decision by April, of how we're going to start moving forward of getting the money out the door, whether it's maintaining the buckets or going to the RFP process. The other thing is with the buckets is we can use also those, to April's point about if we got a survey of the regional capacity of things. If it turns out that there's a specific region that is severely lacking in one of the priorities that's part of that was a bucket, we can just weight that application towards that, right? So if there's a county out there that has like literally zero prevention dollars, and someone comes up and goes, "Hey, for this much money, we can launch a prevention program." And there's 7 other applications in that same county or that same region for stuff that's already more robust and built out, then we would just weight it towards the prevention because that would fill in that gap more. That also aligns with how the ADPC is trying to approach things, which is like not allowing any one service area to lag so far behind that we're always in this crisis that prevention's always in. Um, and so it's kind of building it together. But that's just a long way of saying is that like these two conversations aren't separate conversations.
Yeah, you're right. They're not separate conversations. We separated them in the interests of because we're limited in our time, but you're right. They're not don't have to be separate conversations. So I'm just gonna do a time check. It's 12:08. In theory, we're coming back at 12:10 and with a plan to present to the group. I think we can have 5 extra minutes. So we can go back at 12:15, but I do want to move us towards something that is like a group decision, whatever that decision is, whatever you want to present to the group. Lori?
Thank you. I just wanted to add on, I meant to say before, and it's a perfect segue into this part of our conversation. I'm supportive of the RFP route. I'm using that term very loosely, being mindful of what Carrie said, and as someone who has also been a director of a very small public health nonprofit, the idea of capacity. So I do not want to create barriers to accessing these dollars by the way in which we make clear who is eligible to receive them and what they need to produce to prove themselves, as well as on the back end, what reporting might look like. So I would want us to, this is where framework and mechanism blur. I would want us to design an announcement for that that makes it very clear that these are easy to access, don't require a lot of resource and technical skill to apply for, and make sure that that's true. That is the way that I would like to see us do a competitive process, if you will.
Mm-hmm.
To make it very accessible and easy, because that's equitable. High resourced organizations can apply through a simple process, as can low resourced. But if we make it a very complex process, we're leaving the lower resourced entities and programs out, and I don't want to do that.
Yeah. Carrie?
Yeah, I just want to very quickly say that I am not opposed to an RFP process. Because I have also been really struggling with the fact that our funds are going to people that are already connected with and have easy access to the system. I am about making sure that we are navigating systemic barriers to accessing resources for everyone, equity. I think RFPs still have issues, but I feel like it's better than probably what we're doing now. So I don't want it to come off like I'm not in support of it. I just want to be thoughtful about it.
Yeah, I mean, I think we did explicitly sacrifice equity for expediency, for efficiency in the last biennium, and did that knowing that that's what we were doing. Yeah, and so thanks, Carrie, for bringing that up. So when we get back to the larger group again in 12:15 or before, is this group okay with saying that really we want to lump all $10 million in the same bucket and potentially whatever else is left over in the data and evaluation after OHA does their proposal for how to spend those $4 million? Um, so, potentially between 10 and 15-ish million dollars in the same bucket, and we can talk more about how those dollars will go out the door in April. We can start that conversation here for sure. You can preview it. But I do think it's okay too, Carrie, if you bring up the importance of you know uh, of prevention as we consider how we're getting dollars out the door, and really the if you're preventing, then you are creating less need for the treatment and the recovery down the line. Lori?
I'm great with a focus on primary prevention, not an exclusive
Bucket.
focus, and I don't want to use the word bucket anymore. I think
Yeah.
we just say, we have a pool of funds, and this is how we want to move forward on how to award them or expend
Yeah.
them or allocate them, and not say we're putting it in one bucket.
Okay.
We
abandoned
the bucket nomenclature again. Thank you, buckets, for your service.
Thank you, buckets, for your service.
Enjoy your retirement.
Yeah.
Let's go on a cruise. Okay.
Does that seem fair to everyone? Okay.
Yeah, I would feel okay with saying that we're viewing it as a total pool of money at this point. And that after next month, after the red subcommittee meeting, I'm sure that there's going to be a proposal with a dollar amount. I doubt it will be the entire dollar amount.
And they've already said it won't be the entire dollar amount.
And then that's also, yes, I think that we view it as just, this is the money that we will, as we develop the process, we will be allocating.
Okay. All right. Okay, let's leave this meeting then and rejoin the Zoom meeting, which I will paste into the chat. And I will do a high level share, and then you all can chime in. Sound good? All right, see you over there.
Hey guys.
Hey there. There's Sarah Rose. Sarah Rose, it let me start the meeting, so I hope that's okay.
That's great. Yeah, thanks for getting it going. I will go ahead and put the discussion questions in the chat to start us off.
Well, and Skylar, I think I saw, you have to leave at noon? So maybe you should kick us off with what you would like to do.
So much pressure.
I'm also happy to pull up the Excel sheet tool if that would be helpful. Just let me know.
Well, I'm happy to kick us off because I have an idea that I think is a very simple one for purposes of today. It's a little bit different way to tackle this. I've thought a lot, and Carrie and I have talked a lot about, we've heard a lot from members of the community who are anxious to get proposals in front of us and innovative projects. And we saw all those OHSU proposals. Given that this has already been kind of a wild biennium in the way we allocate money, one thought I had was that why don't we just issue a broad RFP with maybe some guidance about what we're looking for, and then we can review the applications and allocate the money. I don't think we would need to say ahead of time how much goes in each bucket. I'm just throwing that out there. John.
Yeah, that's such a great point, Annalise. We we get, I mean, and you guys too, you'll get requests and how do I get this funded? And I'm like, well, or I'll say they'll have a project or a good example, just being transparent because he was on public comment was oh gosh, I'm my brain Recovery Works Northwest, the guy that run Ben Schwartz, right? So Ben comes and yeah, Scott, you know Ben, and you know, I remember having a conversation with him and because he had contacted me and I mentioned that and, you know, and I said I think it's a great idea. They said, but you know, we are going to have to we need to talk as a board though in terms of what our structure is for that kind of thing because you know that could get very chaotic if we're just kind of saying, oh, I like that, I like that. It's one thing for us to direct allocate through those four channels to things like expansion treatment services, primary prevention, overdose coordinators. That stuff is like kind of universal impact, but I think I'm just thinking out loud. I like the idea actually. But are you thinking the whole amount? So what do we, was it 5 million we have? I can't remember.
It's 10, it's going to be 10. I mean, that's the other thing, right? Is we don't have it all
Moving
in
target.
hand,
Yeah.
right?
Moving
And
target.
the initial question, I guess, to start off is whether you want to keep some or all of the emerging issues funding from 2025 in the emerging issues bucket, because that determines whether there's 5 million or 10 million.
Is it, and I know it's obviously just us three. We're not choosing for the board, but what about kind of like a 50-50 split? You know what I mean? Like the 5-10, like put the emerging issues in there. It's sort of time to go to the savings, I think, the savings account, you know? And just say, hey, half of this is going to be RP. I think just again, be very transparent publicly. I think that it's a good, I think it shows the board's willingness to listen to solicitations. I hate to use that word from the public. Um, but I think we'd have to be really thoughtful about like how we structure that because I still am I feel pretty adamantly that our four-pronged sort of strategy, I don't see a reason to reinvent the wheel and blow it up. I think we do it in the context of the existing structure that the board has kind of created. Because as we talked about all of these things, you know, we all have our different lenses, right? Like mine's more focused on treatment just because what I work in, and it's what I worked in most of my career. But you know, we have and so that aside, I just think keeping those kind of lanes and then working out something that fits into that, I think creates consistency with the board. It actually acknowledges that despite our sometimes our hiccups in contracting stuff out, that we are on the right path with this, you know. Even if you look to other states, I think there's other states that are doing some great innovative stuff. Some not so much. That's not meant to be overly critical, but some are kind of a free for all, you know, like people just kind of come and, you know, you draw straws or whatever, however you want to characterize it. And we don't do that. And I think that's a strength. And I think in the context of our conversation and everybody's comments, you know, what I keep coming back to, and I talk about it a lot, is the chaos, the feeling of chaos internally, externally, nationally, having some having a sort of stick by because it worked our strategy and sticking with it. I think is going to be a really important thing to model, but also to get work done. So my 2 cents.
So John, are you saying, when you said 50-50, are you saying like cut the emerging issues by 50%, or you're saying keep emerging issues 5 million?
Keep emerging issues 5 million and put that and basically put that out for RFP.
Oh, put the, oh,
Mhm.
I see what you're saying. Just do the emerging issues as the 5 million. But
Yeah.
why not do the full 10?
Oh, I'm just sort of thinking out loud, but yeah.
Yeah.
We could do that. We could do that. I mean, that would be an interesting suggestion. I was thinking that 5 million to give, you know, to maybe give the board the opportunity. And again, I'm just
To
totally
just like
thinking,
dip our toe in it.
but yeah, like to try that, but also the other that 5 for RFP that's emerging issues. Because again, I think it's totally appropriate. But like for instance, we funded some research and evaluation, We funded some great stuff that OHSU is doing, like the Clatsop County Jail, CM. Take that 5 million and just sort of solicit uh, projects, but also that other five, the kind of regular, I call it the regular five. I don't know what else you'd call it. Um, how do we continue to bolster our buckets in different ways as a board? Like do we need? I don't know. I'm thinking of. I always think of this as like let's build on what we've. Let's continue to invest, sort of like a house. Like you paint it every several years. You put new, like keeping it. How can we use that money? I know that we could use it to bolster our current investments, you know, to think about things. I don't know. I think in treatment, I think directed corrections MOUD stuff. As a board, maybe we go to ODOC and we go, okay, we want to give you, I'm just throwing that out there as an example. DOC has wanted to do some stuff. DOC has wanted to do more methadone. We've talked to them about it. And I do think, I think there's political stuff and there's all kinds of things, but there's also financial stuff. And maybe that's the kind of thing. That's just one example for treatment. We could think about something for recovery too and prevention. And harm reduction, a risk reduction, whatever nomenclature we're using these days. So
Sorry, guys, I'm in a noisy spot, but I just wanted to put forward, I think RFP would be great. The 5.2 or whatever million, I think makes a lot of sense. Is it possible, Annalise, for us to say, yeah, there's 5 million in the emerging issues fund as well? And if there are more applicants for different things that we want to award to, we could take from the emerging issues fund if we were inclined. Is that possible? I just don't know, process wise.
I mean, we can, right, we can direct it however we want to direct it. And that is really, Sky, that's what we did with the treatment. Remember, we were like, oh, well, we've got this Redmond clinic. Let's take some from emerging issues. So maybe we say we invest a minimum of 5.2 million.
Yeah.
And then we'll think about it. Right. And John,
Yeah,
I mean, I think we could make sure that we invest the 5 million across the continuum as well, right? The RFPs. I just think if we're going to do RFP, I think it would be harder to say like 20%, 20%, 20%, because you don't really know what you're going to get.
that's a great point. Yeah, that's a great point. I was thinking about that because my sort of 50-50 for, us to continue to have that part and then, as the board to decide allocation for that and emerging to be the RFP. Even if we do that or if we do the whole thing, I agree with you. I don't think it's for the RFP. I don't think, even though I think it's got to fit into our structure. I don't think it has to be exclusive, right? Like, oh, you're $2 over on your recovery RFP. You know what I mean, and have that be too difficult. It would be too many. I think it would just get in the weeds too much in terms of getting the money out the door.
Skylar, can I ask you if you have thoughts? Because I've thought about this point too that John made about allocating money to a state agency. Some states do that with their state portion. I'm just curious your take on that. Like, if we were like, is that something that you think you would consider or board members to consider?
I think politically that would be hard. I would just flag from like a messaging standpoint. I think from a process and organizational standpoint, that makes sense, frankly. And I get why other states are doing it. I don't know how that would play out. Just I think in terms of CBOs and mostly CBOs, but I think also kind of local jurisdictions as well. Although I think they'd get on board faster, frankly. So I think it makes sense, especially if you're dedicating it for a particular purpose that the state agency controls. So, it's more efficient in a lot of ways, which makes sense. But I think from just my other hat, political kind of messaging standpoint, I would be a little worried. Yeah.
Those are great points. I think you would have to be really thoughtful the way you did it, and a really clear and a really upfront, like this would be an investment to support. I keep going back to, and I know Dana's here, I can't say anything, but we were in an update from I was talking about from the place in the Dalles, and I'm just like, wow, and this is the positive thing, like how far Fernanda made a great point with this, like how far have become, like they were explaining that they've got police officers coming in there and they're bringing other police officers and they're like, oh hey, I want you to meet these people because they're doing this, and they're like, oh my gosh, that's amazing that we have this here now. I mean, that's like a neon flashing sign that says success to the board and to people from the public looking at the investments the board has made. And I sort of say all that in the context, that Skylar, of you're right. There's all kinds of different things, why even this money of the prison system, and it's recovery. But we have to recognize, if we're going to build off the investments we've already made, that's almost a natural progression, because you're it's just a long-term sort of investment when people are incarcerated by the state, and you know having the board take a kind of a leadership position in reducing the morbidity and mortality in that population. I'd characterize I I'd characterize it as public safety investment in a recovery, a treatment, public safety investment.
And I think the data is there to support you too, John. Like I think when you look at those numbers, it's stark. And so I think it's really hard for people to push back on that piece, if you kind of lead with those numbers.
Yeah. Yeah. Number one.
Well,
number
yeah, and
one
I
cause
think
of
there's
death.
a way, right, that we could do it. And this, I think, John, cuts to your point about keeping some direct allocations.
Right.
Because, right, there are things we could do with direct allocations that just aren't going to happen with an RFP. Like,
Exactly.
like we could be giving DOC, because, I mean, we're progressing, right? But I think we are getting to the place where they might be willing to, be the pharmacy for the jails. So we could give them like some one-time startup money to purchase the medications for the jails. I mean, I think we all know the CJCJ Mood program is on really thin ice going into 27, which would be devastating. So I don't know. I'm just thinking out loud here. Like maybe there's a way we could allocate it to state agencies to go to the locals to really counterbalance. Sky, I think it's important though what you said. Like I do think politically, even though it's the state board, we just have to be careful how we spend that.
Yeah, not impossible and probably worth doing. I think just thinking through how we message it, and if it's for specific investments for specific reasons, I think sharing the rationale is helpful.
And having those conversations, and a lot of it hinges on that particular thing, and that's really just that would be the treatment direct allocation from the board, not the RFP stuff. Because you made a great point, at least like that's the kind of thing where you're not going to get that from an RFP. But I think in structuring that allocation, it would be like in that particular example, we'd have to be really clear with the public, clear with the board member, clear with DOC on what our expectation is. Like we wouldn't want to, just being again very transparent, we wouldn't want to, wake up one morning and read an Oregonian article about how DOC used our money to start an OTP for new buses to transport people around the state, and I'm certainly not. I love like Rob Nutt at DOC's great partner, great guy. I think there's some. I think we'd have to just. I'm just reiterating what both of you are saying. I think we'd have to just think about um, how it would be structured and be really thoughtful about that if that was something. Um,
And would we, so rolling with this idea of maybe saying like we're putting out at least 5.2 million for RFP and the other half we're going to direct allocate, would we wait and see what the RFPs are before we move forward with direct allocation?
I don't know what your thoughts are, Skylar, but I would say to do the RFPs first, you know, and and then also use that as a guide, like still maintain that thing where we're building off this stuff, you know, we're not, we don't want proposals that are like, you know, as we don't want, but we the proposals are going to have to fit into our structure, which is pretty broad, you know, recovery, treatment, prevention, harm / risk reduction, overdose prevention, whatever you want to nomenclature you want to use, and see what happens. And I think it would be really, really interesting. And I think the one thing, the logistics of it, and obviously the PRR team and our colleagues in public health would probably be obviously that'd be very helpful in helping to coordinate that. I'm thinking out loud here again, like it'd be a lot to manage as a you know what I mean? Because I'm thinking, you know, 5 million is a nice chunk of money, but and like to your point, Annalise, I don't think we say like, you know, 1.1 million for treat, 1.2 for prevention. But I also think that also has a risk of, you know, 3 people bringing in things saying like, I'd spend 4 million on this. And we're like, well, wait, you know, shoot, how about 400,000? And they might be like, no, we can't do it for that. You know,
I think it would be helpful for emerging issues. Like the RFP might showcase some emerging issues that we're thinking of. So I think it's just more information, which would be to me helpful, unless it's going to take 3 months and then maybe that's too long. But it kind of depends on, I think, how long it's going to take. But it'd be good information to have.
It will definitely take 3 months.
Oh yeah.
Like that's, and that would be a fast timeline. So that is something to think about, right? And well, whether it was 5 million or 10 million, we would probably need to set a maximum.
Have to.
Because it's just not that much money. It's just not that much money.
$250,000, 350,000.
Right.
Just throwing numbers out there.
And we would probably need to say it's one-time funding, right? We can't promise that we'll do it again. So you need to tell us, like, if you're not spending on one-time costs, or you're standing up something new, right? Like this is, how would you sustain it?
Right. That's right.
And just to confirm my understanding of the discussion so far, what you're talking about is keeping at least the 5.2 million in emerging issues, assuming that that will then be awarded through an RFP process, without designating which categories it will go to ahead of time, and then using the remaining 5 million sort of responsively depending on how the RFP process goes.
Yep.
Okay. Is there any interest in?
I gotta jump, but thank you for relaying our idea to the group. Bye.
Thanks, Skylar.
Thanks, Skylar.
Annalise and John, do you have any interest in kind of playing around with this tool at all and discussing how that remaining 5 million might be allocated, or are you thinking it makes more sense to kind of leave it for now and allow that to just be responsive to what the RFP process yields?
I don't know. You think, Annalise? I kind of like that idea.
I do too. I think that
we're not kicking the can, but like
right.
I like that approach.
Right. I mean, I think it is entirely possible that we get $100 million in asks.
Oh,
and it might be that, you know, 80% of them are too big of ideas that are not sustainable, right? But I think we should leave that open. I will say for research and evaluation, we still have money we haven't allocated from last biennium. So I don't, I would, I wouldn't allocate any more money to research
Not
and
feeling the need
evaluation.
to, yeah.
I agree with that. Yeah, I don't. We invested in it. We invested in some great projects and plans. I don't think we need to. Yeah,
And we'll get RFPs for research and evaluation that relate to areas of the continuum of care. So like, I just don't know that it needs to be separate. In fact, we're probably going to be able to bring some money back in from the data bucket as well, but that's future.
And so is you're thinking that the RFP process will be, I mean, assuming the applications come in as they likely will, at least 5.2 million allocated through that with room to allocate the entire bucket if those applications come in.
What do you think about that, John?
Yeah, I mean, I like the idea of having the flexibility. I think Sarah brings up a good point. Like, how do we characterize that? Do you know what I mean? Like, do we characterize it as, the board's going to retain that half of, I'm again just going off that 10 number, retain half, and then have the discretion to direct allocate to support ongoing related projects or RFP related projects? You know what I mean? Like, how do we? I kind of like that idea. I mean, I think that goes to kind of what you were saying, and at least could be the whole thing. But we start there, and then because I do love the idea of the board being able to say like, okay, we've RFP'd these projects, but we have a little bit left in the bank here to either A, support those, or B, have the freedom to also do some direct allocations for those things that really can't be accounted for in the RFP, like a DOC partnership project with increased access to all three FDA approved medications for OUD and alcohol use disorder too. Like let's make it. I mean, yeah, it could involve like even in some kind of med unit model, but it could also involve yeah, it could also involve addiction medications in general. Um, yeah, I'm just trying to think of how to characterize it. I think I like that idea just to start there and say, half RFP right off the bat, because we want to hear from the public. There's so many people that have great ideas, and let's get that stuff in front of the board. And then let's also though give the board just enough that the board continues to have autonomy to say these are the board have enough money to reinforce the good work that's already going on and continue to support stuff in the context of our conversation earlier today about that it's kind of a fraught environment. Yeah.
So John, are you thinking that the non-RFP 5 million, that we could think about that more for sustaining some innovations,
right?
That that we can kind of touch directly and intervene. So like the burns was a great example.
Yeah. Yeah, exactly.
Figuring out where we could step in. I mean, especially John, I'm sure you feel the same way. I'm just, we've made so much progress with jail MOUD, and I know and it's not very much money that CJC has. I'm just very concerned if that goes away, what happens, right?
Yeah. No, I am too. It's really concerning, and I mean, I think that's why I'm just thinking for that sort of treatment side to have that flexibility to do that, because I popped out the DOC. I mean, I've had conversations with DOC for years and years going back. I mean, Devarshi was probably the sixth person that I remember talking to about a DOC MAT. But I think there's some real movement there. And I also think about that as where's like a hole in this system? You've got the jail funding that's a little fraught. You could also just reinvest in jails, in more jails. But I love the idea of, and thinking out loud on this, how it builds and works with, obviously with the uncertain Medicaid environment. Who knows if we'll have a who knows if we'll be paying for services at any point within a carceral setting for SUD related stuff, but through Medicaid. But just keep going back to the infrastructure, that prison-based state correctional infrastructure that we could help build with an investment would then, you know, I think about stuff like the Jackson County jail methadone induction stuff, and going to visit, like, just being very frank. I mean, Jackson County sends a lot of people to Oregon State prisons. You know, there's a kind of a um, it's not like an experiment, like a mad science experiment, but it's like, why don't we start figuring out how we can keep those folks when they have 16-month sentences and 18-month sentences? They're not going away for 45 years. They're coming back to their Rogue Valley. I'm just using Jackson as an example because they're very progressive with their methadone. You know, keeping those people stable. What's that person look like when they get back to Gold Hill or Ashland or Medford or whatever? They're more stable. You know, they're gonna. It's like I was saying when Skylar was here. Like it's a treatment slash um, public safety investment. You know, that's really what it is. You know, it has some appeal, I think, from that perspective. But I'm just focusing on the treatment part of it. You could also say, well, how could we use that if this model is, you know, taken up or some version of it? Also, what do recovery supports need? You know, all thinking about that, things are going to change here. I'm not naive. But I'm confident. Not confident at all. But I'm hopeful that we have something change in our um, uh, in the you know, the federal national electoral landscape potentially changes in the midterms, which could involve policy change driven by, you know, the legislature at the federal level. So there's always that. I think there's yeah some hope there. You could have overlaps too, like transition to care for folks like.
Well, can I throw something out to you? So I know we only have 5 minutes left to think about for this other direct allocation bucket. I think it could also be an opportunity for us to really target high needs populations.
Exactly.
So this is going back to something we've talked about before. Yes, things could change, right? Again, what are we going to know in 2027? We're going to have a lot more answers that we don't have right now.
Which is great to do the RFPs first and then slide into that, knowing what that environment looks like a little better.
Right. But we could also take some of that 5 million, the second 5 million, and have it be very specifically for populations that might be uncomfortable in taking government funding right now. So some of our immigrant and refugee populations,
Absolutely.
right? Some of our low barrier providers.
Yeah, culturally specific providers that are literally, it's not a political statement to say they're under attack. They're being attacked.
Exactly.
Yeah.
I mean, we could even do that right away, right? Say like, you know what, we're going to take 1 million of the 5 million and we're going to allocate it for high needs populations. Let's do a little community engagement to see what they're comfortable with. And allocate that kind of through a direct process.
At the very minimum, even if you spread that money out a little bit, you might be paying for people to stay in their positions for a year while we have more time to sort of try to ride things out. There is a little bit of that here, like trying to hang on a little bit till the sun comes up, hopefully it does, so things always change. And I think just being responsive with that could be funding innovative work, could be just that, making sure that institutions survive. Because I think, that was mentioned in our discussion earlier too. I mean, there's places that are at risk. And where I think, while I think the board as a whole, or we as the board, have to be careful about, always, we did give a large allocation to the burns, which I was very happy about. I think everybody was. I think we have to be thoughtful about always being like a payer of last resort type thing, but at the same, because it's a weird, it's a weird position for us to be in if that's all that it is. But there's also the reality that if there are pressing needs, and I believe, I cannot speak for the whole board, but I believe that's why we voted unanimously, overwhelmingly, to fund the burns, because they know that burns succeed. Our other investments that we've made in treatment, recovery, prevention, harm reduction are helped by that, in a very visceral, tangible way. Clearinghouse helps the burns get naloxone, period. There's a direct link. We have more treatment availability. That's more places the burns can help connect people to. More places that the overdose prevention coordinators that we funded can work with and develop relationships with. And that was the model, like with the overdose prevention coordinators, that was the model that Kelsey and I pushed with our friends in public health around. What does this look like? They're a resource hub. I want the overdose prevention coordinator in Lane County, which Alex does. I want him to know the sheriff. I want him to know the people, Lane County Public Health, Lane County Behavioral Health, Lane County Methadone, the CCO, the commissioners, be a resource, kind of a hub. How could those dollars that we have in the allocation help to kind of continue to strengthen that? I see funding culturally specific recovery supports and helping these helping organizations survive, just being brutally honest.
But also low barrier access,
Oh, yeah.
right? Like I think about how, Los Angeles right away, because they are much more resource rich than we are. They mobilized resources right away to start delivering in-home substance use disorder treatment that didn't require billing, so that they could maintain continuity and access to care. That's amazing. We probably
That's
don't have the
amazing.
workforce for that.
Right. Just volume wise. Yeah.
But those kinds of things, like, I mean, we can, this money is very isolated from federal restrictions.
You were right. I mean, I think of it's sort of a treatment, prevention, recovery, almost in one. But I think of, and not to call out a specific county, but because they do good work, I'm calling them out. Clackamas, with their follow-up naloxone program, and it's not just they literally will go, you have an overdose, as long as you're comfortable and all you got to do is agree to have me come to your house in Malala or apartment or whatever, Oregon City or Westland, wherever it is, and, give more naloxone. What resources can I help you with? Could be food, could be treatment, could be any of those things. That's recovery support to me, It's also
I don't want
prevention.
to cut the conversation off, but I think folks are heading back to the main room shortly. Although it actually looks like a couple, maybe one of the other groups also is still talking. So maybe we can try to wrap it up in the next couple of minutes.
I think we have a good idea of what we. Yeah. I think
And
we're set.
just for my purposes of reporting back succinctly to the group in a couple of sentences, how would you summarize kind of the framework that we've thought through? What I'm hearing is retain the emerging issues carry forward from the last biennium, assuming that will be used for an RFP process that is kind of responsive to what applications are received.
Do that first.
The remaining 5, yeah, do that first. And then hold the remaining 5 million kind of in undesignated buckets, or I guess we could call it emerging issues again, with the idea of a direct allocation that is responsive to needs that arise during that RFP process or that are not addressed by that.
Yeah.
Can we think of it, John? I wonder if so there's the 5 million RFP that's obviously probably going to fund local projects, and that we have this other 5 million that we look to for like statewide emerging issues.
Thank you, because that's when Sarah was talking. I would characterize it more like Annalise put it, Sarah.
Okay.
Not that you're incorrect, but I don't know if you need to be that granular. I think that is money that the board retains to direct allocate to support ongoing projects. And I think I actually think while we're not restricting it to a particular one of our buckets, I think it should align with one of our 4 buckets. I think because I think that's kind of the way the board says. The other stuff is the RFPs are going to align with that too. I mean, that's what I want. You know, I think it's worth noting that's so the board continues to maintain their same direction, because I think it's, and during this time, I think it's good that the board kind of says, like, we're flexible, we want to do different stuff, but we're not abandoning a model that's a good that's a good structure. We're not going to all of a sudden start going like, well, 100%, no matter what happens, is going to go to recovery. 100% is going to. But I also like mentioning what Annalise said about 2 things that I think that the state board, us, could do is support our culturally specific and specialty providers that really need the help and need even from not to be self-righteous, but even from kind of a moral perspective, like saying we're gonna do this, it doesn't matter what this, to your point, Annalise, there's very little federal restrictions on this money or federal influence in terms of things like with our SOAR grant, we had to change language and we have to make all this stuff. And it would be funny if it wasn't so horrible, ludicrous sort of funny, but we don't have that restriction. So I think that's a great thing to do. It's got great, yeah, I think you can make the case for it. I think continue to support jail MOUD, whether that looks like a direct project with the state to support, and then I think you would think about, and then you still, even if we said we took 1.2 million, I'm just tossing numbers out there for that, 1.25 for each of those things. You've still got 2.5 million for us to say, like, wow, we want to continue to support the stuff we RFP'd that's showing this incredible success. Or we have a little thing here with prevention that we want to fund, or gosh, I don't know. There's so many ideas. Naloxone vending machines on the coast. I don't know. I'm just throwing stuff out there for a harm reduction type of an allocation, but not restricting ours to say, okay, now we've given 25% to blah, blah, blah. I like the idea of with the state allocations, starting out with continue to support jail-based addiction medications, supporting our culturally specific providers.
So for the state direct allocation, kind of maintain flexibility in terms of where that can go, with the intention from the get-go of prioritizing culturally specific providers and high needs populations, and then kind of assuming that the board isn't going to abandon the previous split between prevention, treatment, and recovery, but allowing for flexibility as needed there.
Yeah, I think both culturally specific and high needs providers in jail and jail MOUD. Annalise said it a couple times and they're great points. If that any severe disruption in the funding that's going towards this, it's gonna Again, I say it again, I'm not a pessimist, I'm an optimist, but you don't have money. I mean, they're not gonna do it. You know, they don't have resources, they're not gonna do it. I mean,
And I don't want to cut this off, but we can continue it in the main room.
Yeah, of course.
I think folks are heading back to the
Okay.
Zoom now. I just put the link in the chat, so we can go ahead and join that. But thank you.
Thanks, Sarah.
All right, thanks. Thank you, Sarah.
Okay. Can you guys all still hear me?
Yep.
Great. We'll give Zeb just a minute to come join us. And Adria, I think she was having some link problems, so was going to need to register. I wondered whether you both had a chance to take a look at the Excel spreadsheet that was in the packet. It's called allocation table scenario. Were you able to open that up?
Yes.
Okay.
Now I'm working remotely with one screen, which makes it a little hard to. So,
Sheriff Phillips, I have to tell you that this meeting of all meetings, I always feel the need for like 4 screens because there's like so many things going on. So
yes,
I have a couple screens with me, and I plan, once we get started, I plan to share my screen.
Okay.
And I'll just take notes sort of within the master spreadsheet based on what you guys are saying. So you don't need to have it up right now.
Okay.
Would it be helpful if while we were waiting for Adria, I shared my screen now so that you guys can see what we're going to play with?
Sure.
That would be great.
That working? Do you see it?
Mm-hmm.
Okay. And hello, Dave. I know that you're here, or David. Oh, I can't remember which name you go by. I think we've met once or twice, maybe at a conference. Welcome to our little group. You're here as an observer, as Jenny and Zach mentioned. I think, Dave, you are from a local county, if memory serves, just for Nick and Matt's benefit. Looks like Dave has access to the chat, so he's putting something in there. Dave or David? Okay, so just to give you the lay of the land, Jackson County, that's right. Lay of the land, we are going to be here for about a half an hour. And the idea, it looks like Adria is joining us. Hi, Adria, welcome.
Yay, it worked.
It worked.
That was
I
harrowing.
think we're still waiting on Zeb, who may have had the same link issues. So we'll give him just another minute. I'm sharing my screen right now, and in front of you is a template, an allocation template that Tammy from OHA developed. And what we're going to do today, based on the questions that are in the chat for you to consider, is we're going to start changing the editable green cells in one of these 2 tables, depending on whether you all would like to dip into emerging issues funding or not. And we may just have to start without Zeb, just because I don't want us to run up against the end of our time without getting this done. So my role here is really just a note taker. I'm not leading your discussion. I have the questions for you in the chat, and I'll make sure that you get to each of these questions, and I'll sort of be a moderator of sorts, but not exactly a facilitator. I'll leave it up to you guys to lead your own discussion. And then at the end, when we go back into the main room, I'll do a very quick, like 2 sentence kind of report out on what you all decided. And as Jenny mentioned, the idea today is not to come to a vote necessarily, but it would be wonderful if the small groups could come to some conclusions about the percentages that they want to allocate, and then have that be part of the discussion in the main room. Do you guys have any questions?
Yeah, I don't think I can see anything that you put in the chat before I joined, so I can't see the
Oh,
questions.
I'm sorry. I'm going to
That's
do it
right.
again.
Do it again when Zeb gets here.
All right, how's that? Perfect. Okay, so we'll catch Zeb up when he comes. Just one more pause for any questions, lack of clarity, anything I can explain better. Are we all good to start? Alrighty. So what you're seeing in front of you is the left-hand table is a table that we will all fill out. And again, I have this up in front of me. I'm sharing my screen. I will fill this out and as you guys proceed through your discussion. If you'd like, you can also pull it up. It was in your packets. So if you're having a hard time seeing my screen and you want to refer to it yourself, please feel free to do that. But I can take notes on my screen. The left-hand table is a table that we will work with if you all decide that emerging issues funding should be held back and not considered as part of the total funding available for this biennium. If you would like to consider some or all of emerging issues funding in this biennium, then we'll work with the table on the right-hand side and we can play around with those percentages ourselves. So the first question for you all to talk about amongst yourself is, do you want to keep some or all of emerging issues funding back from 2025 in an emerging issues bucket?
Can you give me a reminder on how much money that is? Or
yeah, it's $5 million ish.
okay.
And I might have
And
a little bit of a different takeaway and understanding from the retreat, but for some reason I thought that when we had the conversation about the $13 million allocation to the burn, that we talked about using the emerging issues funding for that. So in my mind, I had already just considered that spent and that we were looking at available resources, just kind of not necessarily holding that back, because I think that we had a conversation that if there was any characterization of an emerging issues, the level of gap that we had with current contracts and the funding available, that using that definitely made sense.
yeah, Nick, I do remember that conversation. I don't know that any decisions were made on that, specifically that it was going to come out of the emerging issues bucket. So my understanding is that bucket is still 100% untouched.
So in the table on the left is the unallocated 5.256 million. Is that the emergent issues money?
No, that is the bucket that we have available to allocate without considering emerging issues. And the one on the right, that's 10 million, includes emerging issues.
Okay, I got it now. Thank you.
Yeah. So how do you all feel about the emerging issues bucket? Do you think it should be kept intact for a rainy day? Is that rainy day here? Do you want to use some or all of it to make your available allocation total up to 10 million?
So my gut feeling, and I'm more than willing to take a back seat on this, but is that the changing funding landscape in and of itself is an emerging issue, and it would be an easy justification to allocate those funds.
I agree 100%. And I would look at, I think for my paradigm, I'm looking at it as having 10.5 available for distribution and then potentially applying whatever sort of percentage we had previously for emerging issues, like keeping that percentage from that pot if the board decided to do that, but definitely not setting that entire 5.1 aside, given that that's half of the revenue we would have available.
I would agree. I feel like our responsibility is to get the money dispersed and funded and put into action. If we were providing direct services, I could see a case to keep money in contingency, in reserve. But that's not what we really do. So I think it'd be
All right.
best if we spent it.
Well, that was easy. All in agreement to use emerging issues. So what we're going to do is on your screens, take a look at the larger of the tables, which is on the right, and you'll see primary prevention, treatment, recovery, research and evaluation, and emerging issues are all cells that we can play around with percentages. And what will happen is I can show you if we just start putting numbers in here. We do 10%, 10%, 10%, percent. So if we decide to allocate 10% of funds across all evenly, you'll see in cell 33 that we would have negative funds. Let's see. So basically what that would be is.
So with the 31.4, yeah.
20, yeah. So that puts us over.
So what do we actually, percentage wise, we have 12.46 plus 31.46 minus 100. Okay. So we have 56% to allocate.
Exactly. 56 to play around with.
Is that correct though? Because like we have to consider the tribal and the administrative as well.
Exactly.
So
yeah,
I think we're looking more at
25%.
Yeah, exactly. That's what I was just going to say. We have right now we have $237 left, which is about what our bogey is. If we allocate 5 across, so we have about 25%.
Isn't this scheme kind of what happened last go around?
Yeah, exactly. This is, yeah, it was fairly equally distributed across. And I guess our question for you all to consider is, given the changing landscape, given the smaller pot of dollars that we have available to us this biennium, do you want to make changes to what was a fairly evenly spread distribution of funds last time around?
Help me remember. I feel like we had substantially more for the first 3 buckets of prevention, treatment, and recovery, and that research and evaluation was smaller, as was emergent issues.
That's correct.
So I guess I would suggest that we throw more money towards prevention, treatment, and recovery, and take a little off of research and evaluation and emergent issues.
But would it be a bad idea to take emerging issues down to 0? Because isn't emerging issues essentially just a holdback?
Yeah, I'm cool with that.
I think that makes sense. I think how we're approaching things in the conversation that we just had, we're going to be looking at how do we develop stability in a system versus enhancing and building out new programs. And so I think that everything that we're going to address in this over this biennium is likely going to fit in that emerging issues like bucket anyway. So I don't necessarily think that we need to have a set aside there.
Mhm. Okay, so you'll see I zeroed it out. I added 2 more percentage points to the top three and kept research and evaluation at 5%. So we're a little bit in the negative right now, but close.
On the research and evaluation, is there anyone lining up to do some research and evaluation on our programs? Is there, I know OHSU is working with my county on contingency management for research, but is there anything else do we need to have $2 million sitting there?
Yeah, research and evaluation is strongly tied to the data piece, and the data subcommittee has been meeting. And OHA, Steve Westberg is going to be proposing something at the next data subcommittee, and it looks like the data piece would be handled within OHA. Research and evaluation is not captured wholly within that category, but their work is kind of dependent on the data piece. So data is not lined up and ready to go, and proposals to spend are not being considered right now.
And remind me, do we still have that the funds for the data piece set aside?
Those funds were, oh gosh, I wish I had last year's in front of me.
We didn't add them back to the pot. We kept them.
We kept them there. Yeah, they're sitting there but some of them have been spent. So they're, if you want additional money allocated to data and research, you would need to preserve that in this budget.
I guess my feeling is I feel like we haven't heard an intense ask for more research and evaluation funds.
Right.
And we definitely have some emergent needs in the other categories. So I would be inclined to take research and evaluation percentage down, but maybe leave 2%. Does that sound right to anyone else? Or I'm sort of just making this up.
My gut was saying 2% as well, and doing like 2% and then looking at around 8% for the other three. Made a lot of sense to me.
Okay. We're about on track with 88820.
I think we're awesome. That was good.
We're so in sync.
Yep.
And so your question, I just want to make note of your question regarding data. Data, you've elected to decrease it because nothing is kind of teed up and ready to go at this point, and there are other urgent needs for the dollars.
I would certainly be willing to listen to other perspectives on what we expect out of the data subcommittee, because I just don't know.
Yeah. Okay, and then let's see, did we cover question 3? I think that this has been sort of underlying for us throughout this conversation. How do allocation decisions made last biennium factor into our prioritization? I will just say that up to now, you all have been considering, similar to last biennium, the 3 primary prevention, treatment, and recovery as being equally important in terms of allocated dollars. Is that what you want to say in these numbers?
I think that's accurate for me.
Okay.
Absolutely.
All right. Let's see. I might just change all of these to 7.5 and see if that gets us to 0. But otherwise, I'm gonna say maybe 8 is just close enough.
We're further off.
Now we're further off. Yeah, I'm gonna keep it at 8. 8, 8, 8, and 2. Okay. All right, well, we're done with our spreadsheet. For the report out, I think what I'm going to share is that you all felt that emerging issues should be tapped into, that the current landscape is such that the use of using those additional $5 million is sort of an emerging issue. You felt that the top 3 categories were of equal weight, and that research and evaluation, there are some questions around, but while you didn't want to zero that out entirely, you felt that because there were no immediate research and evaluation needs, other things took priority. Is that about fair? Is there anything else you'd like to add?
Oh, that was a good summary.
Okay. Are there any questions coming out of this process for you guys? Questions or concerns that you want to be sure to bring up in the main group? Aside from the data piece.
I think for me, it's just looking forward to process. Like once we make allocations, like what does that look like? We had a lot of folks come to us seeking funding last year, and the process was sort of unclear related to how they came to the board. And so I guess considering the level of instability we have in the community, and anticipated instability, like how are we responding to requests? How are those requests coming to us? Because if we're looking at these as being equally as important, how are we just making sure that we're having some sort of process where we're directing it to the highest need in the community?
Yeah. Nick, I think that's you're not alone in needing that. I think that once this structure is in place, the process part is the next thing to be tackled. Any other questions or concerns coming up for you guys? Okay. Well, I'm going
to do my best to get us more money.
Yes. Go, Adria.
I'm trying.
I'm going to stop sharing my screen and we can leave this meeting. I'm sorry for the hassle, but you'll need to re-log in to the Zoom meeting. We're all due back there in about 10 minutes, so don't feel obliged to go immediately to that room if you would like to do something else for 10 minutes. We'll see if other folks are as efficient as our little power group. Maybe everybody will be back early. I'm not sure, but my plan is to go back to the main room and we'll do our report out at 12:10.
Sounds good. Nice working with y'all.
All right. We'll see you soon.
You all. See you in a bit.
Bye.
Time to, for folks to ask questions, and then have a conversation about it, about all of the proposals. As a group, we're not necessarily expecting to come to a decision today. And so we'll probably be finalizing a decision in our next meeting, but we'll get as close as possible in the time that we have, understanding that that the work is urgent, as you all mentioned in our before the break conversation, and that care delayed is actually care denied. So keeping that in mind as well. All right. Do we have Sarah Rose's group back?
They are filtering in now.
Okay. Excellent. All right. I think everybody has filtered or close to it. So we'll start with group one, which is cheating a little bit because that's my group. I will just really quickly give a high-level overview of our conversation. We'll have probably opportunities for one or two questions after the high-level overview. Please, group members, if I miss anything, chime in as well, or if there's any nuance you wanted to add, chime in. And then the same for all of the other groups. And then we'll all we'll see what sort of themes are coming or that we're seeing after each group presents. All right. So my group has decided that to retire the bucket or the categories altogether, to thank them for their service in the last biennium, and to really just think about having a pool of funds from which to really address the issues that are coming up. And we did get a little bit into the how conversation that we're going to spend more time on next month, which was, the recommendation is that we think about an RFP process that will allow us to be more nimble, to think about the needs and the specific geographies where people are, to set priorities that are also that are based on where services are happening and not just on who has the most access to OHA or already has a relationship with OHA. One thing that was brought up in my group as well was that one of the things that that prioritization exercise that we did way back 2 years ago did for us was that it made sure that prevention did get some dedicated funding. And because that work is so important and also hard to evaluate. And hard to argue for because if you're preventing people from getting into the system, that creates less burden on the system overall. But then how do you know how many people you're actually preventing from getting into the system? So that was the overall conversation that my group had. There was also just noting too that the data and evaluation funding wasn't included in that overview, Tammy, that you gave, and so there was some interest in understanding what OHA's proposal will be for the data funding that we will hear in the RED subcommittee meeting in March. And so whether or not there would be perhaps additional dollars to put into that overall pool. So somewhere between 10 and $15 million in a pool for the next year and a half. Did I miss anything? Group one, folks? All right, any questions for the members of group one from the other group folks? Annalise?
Just real quick, when you say throw out the buckets, does that mean like that they that we're not going to invest across the continuum, or just not assigning strict numbers to each
Not assigning strict numbers to each part of the continuum. April, do you want to talk more about that?
Yeah, thanks. Jenny is very trying her best here to steer us away from talking about the mechanism, but it felt integral to our conversation. And so, what we were talking about, while we don't want to think in buckets, we are all also going to be held to. And I'm looking at Adria's square, so see her delight when we are looking at making sure we're holding ourselves to the eligible activities that are outlined for us, and thinking about evaluating any if we go an RFP route, evaluating criteria from a weighted sort of criteria that would include prioritization for certain categories in certain regions for certain populations that align with a lot of the things that we talked about this morning. So I think while we are not thinking in buckets anymore, we are also thinking more systemically, recognizing that each community needs investments in all of those areas and evaluating investments from that perspective.
Any other questions? All right, let's hear from group 2.
Yeah, I can share out a bit about what group 2 talked about, and Annalise and John, feel free to jump in, please. Skylar was also part of the conversation, but had to head out at noon. But it sounds like group 2's conversation was similar in some ways to group 1. We kind of got a little bit into the how and discussed the kind of prioritizing responsiveness overall. So keeping the 5.2 million allocation from the fiscal year 25 carryover in emerging issues, and then possibly allocating that through an RFP process to start off, and then holding the remaining 5 million that the board can allocate directly after the RFP process in response to kind of emerging needs. And Annalise or John, if you want to jump in with some of what you talked about with the prioritizing culturally specific providers or high needs populations, please share as well.
I'm happy to jump in real quick. One kind of additional detail, a couple additional details. So I think we were thinking of the RFP bucket similar to group 1, that it wouldn't be a hard and fast allocation for each bucket, but that the hope would be we allocated across the continuum of care, with the thinking being that those would go to local communities that are most in need, and then keeping the other half that we could either allocate some of that if we get, as I predict, like $100 million in applications to that bucket, and or we could use it for statewide purposes. A couple of priorities that we started talking about for statewide purposes were, one, culturally specific services and preserving and protecting and making as low barrier as possible right now. And then also thinking about MOD and treatment delivered through our local jails, because we all know that that is an evidence-based practice to reduce overdoses. John, feel free to jump in if I said anything wrong or you disagree.
No, I thought that was a great summary, Annalise. I think the theory behind that is that we kind of do it in the order of do an RFP with that emerging thing and solicit, and then still have that money that it's millions of dollars, but it would go quick, but having that, so that maintains the kind of board's leadership around investing in things that are tangible, impactful, that continue to build. I keep stressing this, continue to build on work that we've already done. Because I thought a great start for that, we thought would be making an immediate investment direct from the board to, I don't know what that would look like, I think we get into details, but to culturally specific and high needs programming in the state, because I think it's needed. Number one, I think it also it's stuff that we talked about that it might not be things that we'd get to in an RFP on a statewide basis. And then also the issue of jail MOUD. We've had changes where, we're kind of putting in internal correctional Medicaid funding on pause, which is, I mean, I understand in this environment, but it is such an impactful thing if and the funding is fraught, right? Like with jail MO, with 4002 and the CJC money. So this is supporting stuff that we've already invested in through federal grants. We've invested in treatment and recovery supports for people leaving, incarceration, whether at the state or the local level. And so continuing to help, even if it was, I guess we talk numbers, but
Yeah.
have those as the two first sort of priorities from the state bucket, and then move on, to other things. That could be with the rest of that 3 million. I'm just throwing out $1 million here, like here and there. Could support stuff that's already the RFP things that we want to continue to support. It could be investments we made in the first half,
Yeah.
with overdose prevention coordinators, primary prevention, recovery supports.
Yeah. Yeah, exactly. Yeah. Thanks, John. Yeah, so groups 1 and 2 had sort of similar ideas to at least do away for some portion of the funding to kind of do away with this idea of buckets and instead use prioritization to think about other things that are not labeled, treatment, recovery, and prevention, but that are also important. Although, again, Group 1 did want to stress the importance of prevention. Yeah, let's hear from Group 3. And it's okay if you guys came to an entirely different conclusion, Group 3. That's all right. We're going to talk about that.
We're going to buck the trend in Group 3. Group 3 included Adria, Sheriff Phillips, and Nick. And this group generally wanted to keep the same structure as before, the same set of buckets, although giving priority to primary prevention, treatment, and recovery. They felt that using the emerging issues dollars from last biennium was warranted, given the current landscape, that it is in fact an emerging issue, and that bucket of money should be used. There were some questions around research and evaluation, which the group saw as less of an urgent need compared to primary prevention, treatment, and recovery. So while they prioritized those 3, research and evaluation got a lesser percentage of the total pot. And our group, like the other 2 groups, had questions around the how and the process, as well as asking for a bit more clarity around the data question. So they weren't exactly sure what to do with the data line item and how much to give that because of just a lack of clarity around that. Adria, or anyone else in the group, do you have anything to add? Or are there questions from the larger group for Group 3?
Just that I started off by saying that I am more than willing to listen to the members of our board who have a more holistic understanding of the landscape, and I guess I went into this with a very literal mind. So I'm really happy to hear other perspectives about really looking at this differently.
John?
I just wanted to make a comment, Kristen and Adrian, say I don't know. I don't see them as being that. I think we're all pretty close. It's not surprising, but I don't think it's far off. I think to your point, Adrian, maybe because to my comment in the chat, I think absolutely there's still, I think there are guideposts. I don't know what nomenclature you want to use, but yeah, I feel like they all kind of align. Maybe I'm just being too optimistic, but so.
Nothing wrong with optimism. Chair Phillips?
I'm thinking about how to articulate this well, but I think that having the different buckets of money is actually a good thing with, and I guess what my experience is on a different board where we had kind of one general pot of money, the more influential uh, the groups that companies and providers that have more staff and grant writers and stuff like that, they're going to probably be better positioned to come in and take larger shares of the money that isn't put into buckets, and that there would be fewer providers around the state that would have an opportunity. And then definitely on the prevention side, we have to put, in my, I believe, equal effort into that, so that hopefully this board, our work is done by the time the payments are done, right? That we've really made a difference in Oregon.
So for you, Sheriff Phillips, you're advocating for keeping some sort of guidelines or boundaries, or what we have been calling buckets, so that it's a way to kind of protect specific priorities. Is that what you're
Priorities,
thinking?
and also I think it does help the smaller agencies make an ask.
Mm-hmm. Yeah, thanks. Fernando?
You're on
You're
mute,
muted.
Fernando.
See, this is because we move from one
Got a top and the bottom.
platform to the other.
Don't play nice. Yeah, I just wanted to kind of follow up a little bit on this conversation between like static percentage bucket allocations for the money versus the RFP process, because it seems like they're at odds when they're not. All we're simply proposing is that on the high side we have $15 million. We gave roughly 22% to treatment, recovery, prevention, and harm reduction. So when you divide up the math on that, it's not a lot of money at all to dole out. And so, especially as you get towards some of the stuff that is more expensive to do, that dollar becomes smaller. So what we're actually proposing is to maintain those categories, but then weight them as far as evaluating the RFPs that come in. So it's not that we're going to say that we're going to ensure that prevention gets money in the place where prevention, for example, could use it the most. So, for example, if a county comes to us that has no prevention program, a program says, hey, we need this much money to start a prevention program. Our county doesn't have one. And then in that same county, we get 6 other RFPs for services that would be duplicative or already more robust. Well, obviously, we would weight the prevention grant higher because it's a higher need in that county. So really, it's moving away from static bucket allocations to using those buckets to guide specifics around where money moves to. Because again, $10 million, to make the math as easy as possible. If we have $10 million and we're giving 22%, that's $2.2 million. That's not enough money to give to a treatment program anywhere, really, to do anything. Um, but it can be a very meaningful allocation in a place where it doesn't have a specific, let's say, recovery community organization or recovery drop-in center to be like, well, hey, man, here's 250K. That's an easy. So it's not so much like getting rid of the buckets. It's just getting rid of the static allocation to each bucket and then just maintaining that, saying, well, we don't have enough there, so I guess we can't give it.
I think what I hear you saying, Fernando, is there's an opportunity to talk about priorities later as well. This doesn't have to be our last conversation about priorities. And, if we in April, we're going to spend the meeting really talking about process, and so what I hear you saying is there's another opportunity to talk about priorities there as
Well,
well.
really clearly though, I want to like ally, because we went back and forth. It's not just that we're not going to talk about this is not the time for priorities. What I'm saying
Right.
is that those priorities will still be there.
Yeah.
It's the way that we are talking about them that will be different.
Yeah. Lori?
Thank you. Thanks for that, Fernando. And I just wanted to assure Matt to his point about making sure the dollars are equitably accessible to lower resourced organizations. We talked a lot about that. I don't think the current buckets help with that at all. So we did talk very specifically about having intention around the process being simple, easy to understand, and not requiring a lot of resource to access the funds, to demonstrate need for the funds, to report on use of the funds for that very reason.
So there are, it sounds like two broad proposals, one with a variation. So one proposal is that we do kind of categorize the funding. We keep buckets and we categorize these funding, uh, in the same way that we have before. And another one is that that we don't. And the variation is that the group two proposal has sort of a phased approach where you're doing maybe an RFP process up front and then kind of deciding what to do with the next 5 or so or more, depending on what might come out of the what might be available after the RED subcommittee conversation this month. Um, so yeah, what are folks thinking about those three different proposals? Sheriff Phillips?
Well, I guess I'm just a little bit curious about the history and and how it was originally set up and how we decided to allocate money and why we're moving from that
Yeah.
theory, or why
I'll
people
just
feel strongly about that.
I'll just say that from the history perspective, originally we were talking about priorities and how we were going to prioritize these different needs, these different places along the SUD continuum. And the words that we came from Exhibit E, prevention, treatment, recovery, harm reduction. Prevention is actually it's the longer title is primary prevention. It's like the pre-prevention activities. And it was a way for us as a group to talk about the needs in a way that we were all using the same language and the same definitions, and and it worked. And essentially, I mean, we surveyed the group, and the group came up with this idea of really allocating the 30% to the tribes off the top, and that's in for as long as the settlement funding lasts, and then with remaining funds, there's about the buckets were about 22% for prevention, treatment, and recovery, and then the remaining dollars for emerging issues and data and evaluation. Fernando?
Yeah, Matt, a really easy way to think about what happened, sorry, Jenny, is we basically took, like Jenny said, the names that are in the title and then roughly divided those equally, 25%, and then started taking little pieces to make the emerging issues bucket and the research and data bucket. That was done for expediency. It was not done in like a thoughtful, mindful process. It was literally just like, let's get something going so we can start like getting money out the door. And so ever since that, there's been this kind of drive to like be a little bit more intentional around how we're going to move that forward. Because of some of the issues that have come up of less like it costs more to do to start set things up in a treatment setting than it does in a prevention or a harm reduction setting. And so it's being more intentional about it as opposed to the just like 25% divided by four. Let's take 2% from here to 1% from there to create this bucket. Okay, cool, let's go.
Yeah. Sheriff Phillips?
Yeah, I was just thinking to myself, would we be having a different conversation or having different conclusions if we didn't already allocate 20 or $13 million to the burns? Does having less money for the next year and a half make us evaluate this differently? And then down the road, say the burns are funded again, and we don't have to give them our money, our money, that we would go back to something like where this organization started.
Yeah, that's a good question, Sheriff. Annalise?
So, I don't want to disagree with my commission member Fernando, but I do think it was intentional to allocate across the continuum. I think that was a pretty intentional choice. That said, even in the first round, we were not rigid about exactly how much went into each bucket. Like it was arbitrary to say we gave a little bit more to harm reduction and what was it? Primary, or maybe it was primary prevention and recovery. Then we gave to the other two, and then we allocated more to treatment because that opportunity was there. So I don't think we've ever been super hard and fast. I will throw out to this whole discussion is I personally, from hearing everyone, I think it's less about what the allocations are between the buckets and the method. So in the first round, we did decide to really focus on this kind of statewide infrastructure with direct allocations. We've had a lot of feedback that folks have these local ideas. They want an RFP process. And so I will just say that for next time. Like, I'm not really hearing anybody say we're going to spend all the money in two buckets or anything. I'm not hearing that. Right. Like, I think it's more about, okay, how do we balance needs that we could kind of at the state level say, well, let's plug some money in here. Let's do direct allocations for culturally specific services and balancing that with like a broader process. That's my take.
Yeah. Lori?
Thank you. Thanks, Annalise. I think we're honing in on, I think from our group, at least certainly Fernando and I, getting rid of the word bucket implies there's a finite amount. You reach the top of the bucket and you can't spill over it. And that we want to move into, we are in a different place than we were talking about the continuum, as you say, Annalise. So, because we thought of the buckets as a way of expressing the continuum, but we put certain amounts of money in each one. And there's just, the feeling was, why limit ourselves that way? I mean, it's a more important exercise if we had more money, or the buckets are now smaller is another way to look at it. So why even talk about buckets, I think is what we're saying. So shifting our language in a way that also helps bring people along into understanding what it is, what the impact of these dollars can do, which is there is a continuum. And we are working to shore that continuum up and be innovative and support structural and systemic change across this continuum. We have this pool of money with which to do that. Go. It's just, it's an important, I think it's an important semantic shift that it better reflects where we are and where the community is in learning about this resource and this opportunity for funding.
Thanks, Lori. All right, so I'm going to, with like some reluctance, but I'm going to stop this conversation here. I agree, Annalise, and I think this has come up with other folks as well, that I do think that the energy is to have a conversation about the mechanism and the how, and that is where we're going to really spend most of our time in April. I do think we're close to talking about what that means for priorities as well, but I'm wondering if maybe as we talk about the mechanism, that that sort of priorities conversation will happen naturally. And I'm also really happy that we spent this time both in your small groups and here together talking this through today. So I think this was time well spent, and everybody was really thoughtful about this. I will say that I mentioned this in my group, but the original plan was to have this conversation in January at our retreat. We didn't do that because we were being flexible to the issues as they were emerging in real time. And in that conversation, because we were going to have more time, the plan was for in the small groups to like wed those priorities and process conversations and to have it together. And we all thought, and the co-chairs thought that we needed to have it over a couple of different meetings because we probably weren't going to have time to get deep into the weeds as we need to. As it's 12:47. We can see that, but we will have time for that in our next meeting. April, do you want to close us out and then we'll head to public comment?
Right. I forgot we have public comment time set aside. Are there folks signed up? So my idea was that we should spend a couple minutes just as a board deciding what we would like to do with our time together next time, because I think there's some data that we could share, present here. I think some of Sheriff Phillips' questions are really highlighting the background that maybe we haven't provided around how allocation decisions were made in the past and how we didn't do a big RFP process. And that's what we're really responding to in this conversation, which is, it wasn't always the most intention on the front end of how those decisions were made. And so I think that maybe doing some background on how this worked before and including some of overview of I believe there's new overdose data that we can look at together. I know the packet that went out for this week included some from 24, but that was really helpful in us starting to think about where that demand is beyond kind of the feelings and fears and things that we heard this morning. But I'm hoping that we could have a little bit of time as a board talking about what we would like to see for the next meeting, if there is some time. But I don't know how many people have signed up.
Let's go ahead and have our public comment time, and then we'll see what time is left, and we can use it in that way. Does that sound good? All right. So Carrie, do you want to introduce the public comment? And then I think we have at least one person signed up. We do have two written comments that are in everybody's packet, and they'll be reflected in the meeting summary as well. So we won't read those, but they will be in the record. And yeah, so Carrie, go ahead and introduce the public comment, and then we'll hear from our person.
Great, thanks, Jenny. The Opioid Settlement, Prevention, Treatment, and Recovery Board welcomes and appreciates public testimony. We will do our best to not interject during public testimony. We will, however, bring it fully into our awareness, understand it as an important consideration for our work, and listen with careful attention and respect. We want to acknowledge that time held in our meetings to hear public testimony is meant to provide a voice and perspective from that individual and is not a representation of the Opioid Settlement, Prevention, Treatment, and Recovery Board, its members, or the Oregon Health Authority. Each presenter is given 2 minutes to share, and if that doesn't feel like enough time, we encourage you to provide written testimony to share with the board. To help keep us on time, we'll start a 2-minute timer for each commenter. We kindly ask that commenters conclude their presentation when the timer is complete. So, we do have one public commenter, and I'm very concerned that I will not pronounce your name correctly, so hopefully you will introduce yourself. Nirmala Dar?
That's correct. Thank you. I have 2 minutes, so I'm going to get right to the heart of it. Nirmala Dar with Oregon Health Authority Behavioral Health Division, Older Adult Behavioral Health Lead Strategist. I have already written to the board extensively. I'm here to really highlight
often the forgotten needs of older adults in this opioid crisis. They are the one group where we have not seen a decrease in opioid use and death. In fact, we have seen an increase, and I've shared data on that. And so I am reaching out to the board to really look at the demographic reality of this growing population, this aging population who are prescribed uh, opioids, in high doses, and where rescue inhalers have very low prescription utilization. And so I am urging the board to please review my letter that I sent to the board about a year ago. And as you look at this new funding paradigm that y'all were discussing for priority populations, that you don't forget older adults, because I have seen the programs and the funding that has gone out in the previous years, and I was not able to identify any funding that went specifically for older adults who are age 65 and older, whether it was to the burns or to specific programs, or largely, for work with this population. So again, I want to urge the board, as you'll meet, to really consider older adults as a priority population based on the data that was included in the package that I sent to the board about a year ago. Thank you.
And Nirmala, if you wouldn't mind resending that to Lisa, and we can make sure that it is that the board has access to it, so they don't.
I absolutely will. Thank you.
Thank you. All right, so we have 7 minutes that we can dedicate to that conversation that you were suggesting, April, about what does the board need in order to have this how conversation that we're going to finish our priorities conversation and to have the how conversation in April. So yeah, let's open it up to all of you.
I'll start since I asked the question, but I guess I'm wondering from the rest of the board members what may be helpful to prepare for that conversation or to see in to inform that conversation.
Yeah, and Sheriff Phillips, please feel free to chime in here, since you also don't have some of the history that some of the other board members do. Courtney? Sorry.
Yeah, thanks. I was just going to extend the offer to have our overdose epidemiologist join the next meeting to give a data presentation of the most recent data that we have. We do have a complete year of data for 2024. We have preliminary data for 2025, noting that it is preliminary and only through the first half of 2025. But if that would be helpful, we can have her come and present and just kind of have a discussion on those trends that we've been seeing.
Oh, that is a potential, but Courtney, before we start with the solutions, let's see what the board members are asking for. Fernando?
Yeah, for the next board meeting, I'd like to have a more nuanced discussion around if if we're formally retiring the term buckets and we're kind of moving towards priority areas. I think it would be worth it to start having a discussion around priority areas, and how we would rank those. Because obviously part of why every single one of us is in this group because of our subject matter expertise. And so we're going to represent that subject matter expertise in different ways, but there will be overlaps on Venn diagrams of funding priorities. And I think it might be worth it to start moving in that direction. So that's my thoughts.
Yeah. And Sheriff Phillips, I'm sorry, you were coming off mute, and I interrupted you. So a more nuanced conversation from Fernando. What do other folks think you need to have that more nuanced conversation? John?
I tend to agree with Fernando's statement. I like the characterization because I think even though like Kristen was saying about being different, I didn't see anything that we all said as groups as being like radically different at all. I just think there's some clarity, and I think that Fernando, I don't want to words in your mouth, but I think that's maybe what you're speaking to. Just continuing to clarify that a little bit more and come to a consensus. I think we're there, almost there.
Mm-hmm.
And then I think after that, because I think that's first, and then if we had more time, sure we could, but we don't. And I think have continuing that conversation, and then yeah, coming to some conclusions there. I don't know that we do have urgency, of course, but I don't think that we have to um, you know, make all of those decisions in one meeting. I like the idea of just talking through it so everybody has a shared understanding, because I assume we are going to vote on it or the like. So that would be a shared understanding, which I think again we're super close to. And thinking about that as I made in the chat, getting rid of the bucket, and I love that, because bucket implies, this much goes in that bucket, that much goes in that bucket. Well, having some nuance there. We want to be equitable. We want to be equitable. Like we don't want to just fund just one thing, but at the same time, sort of taking off that, but continue to use them as guidelines, guideposts, because they really are. They're not just because they're in Exhibit E, which is important, Andrea, but they're their description of the continuum, and keeping the conceptual nature of the structure. I think continues to show the board's commitment to addressing the continuum of care, which I think we've done a pretty good job of so far.
Yeah. Thanks, John. So you're also advocating for the more nuanced conversation. And just going back to Courtney, what your offer was, I just want to get an idea from the board. Would it be helpful? Would it inform that more nuanced conversation to have a data presentation beforehand, or is that something that you would like that would be helpful later after you have that more nuanced conversation? Maybe just raise your hands if you're interested in the data presentation that Courtney was offering. So April's interested. Are there other takers? John?
I'm not uninterested. I just don't know that I need it in advance of our next meeting.
Okay, so let's table it. I think it will be important. But yeah, let's go ahead and finish this what and how conversation, and and then I think another thing that we can do is send out just an email and have you guys have the opportunity to respond back in writing about what your needs might be as we prepare for this April meeting to finish this conversation. And you can tell us, especially after, I don't know if everybody's had a chance to look at the meeting materials for this meeting, but maybe if you look at that material, some thoughts will come to you. Fernando?
Yeah, I just want to this data presentation thing. I think it's valuable. I also think that Rick said something really important in our January meeting in person, which is this is a group of subject matter experts. So you can just send us like a summary of data presentation 2 weeks beforehand that we can use to inform the conversation instead of spending 45 minutes or an hour listening to data that's going to tell us that we have a huge overdose problem in the state, which we all know. I really, really feel like we are spending too much time in this group preaching to the choir. Um, we all agree that there's an issue in front of us. We all agree that there's something to do about it. Data can help us, and also we don't need to spend all this time setting the stage for the conversation.
Yeah, love it. Okay. Thank you, Fernando. All right, just noting that we are a little bit after 1. We're a little over time. Thank you, everybody, for having this really, really thoughtful conversation today, setting us up for a really thoughtful conversation in April. And so we'll send out that email asking for your thoughts about what you need. And noted that Fernando, your suggestion of maybe doing a little bit less presenting and a little bit more having you guys look at the material ahead of time so that you can be ready to have the conversation when we meet.
Jenny, when you say you're going to ask what we need, is it possible to get an agenda a little bit further ahead of time than the day before or the Friday before? I feel like that would help maybe with the preparation time for on our end. Instead
Yeah,
of I can ask for kind of a blank
we
check, but like, can you tell me what you're thinking? And then I will know better how to respond to that question.
Well, I can tell you that in our next meeting, we're going to be talking about mechanisms for how to get the money out the door. That's going to be the focus of the next meeting. We'll talk with the co-chairs about our planning timeline and how to make sure that we get you an agenda earlier than, like you said, the Friday before the meeting. And we'll see what works for them as well in terms of the meeting planning. All right.
Can I just add just on the logistics, the agenda, if it takes a while to gather the materials, those could come a little, but just seeing the agenda sooner would
Yeah,
help.
absolutely. All right. Thanks, everybody.